To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Father, I pray that you would help us today to give us wisdom for the business of the hospital. And just really pray that you would give us wisdom and vision and help us to really see what's best for the hospital and for the community. Thank you for that. It's in your name we pray. Amen.
Amen.
Okay. Carrie, can you tell, I will ask somebody else if we have, Nathan, do we have one?
Yes.
Okay. I'm sure you can see us, Carrie, but it's probably better for somebody in person to do that. Okay, and then, do we have any additions or changes to the agenda?
I have three probably very brief additions that are, I wouldn't say they're urgent, but they are very time sensitive. I think it would be unwise to leave them for another month, and I thought it would be best to add them under the new business section just before subpoint E.
Okay, and what are they?
Well, they're not your executive session, so just in brief.
Before,
Yes, I can.
between D and E.
Yes, between D and E, and if we would like a very brief synopsis, I can give you that. Is that, yeah, okay. So we are, it would be better if we had our financial update, but since we've been in finance committee, we are undergoing a period of immense
Okay,
change.
so it has to do with finance stuff.
Well, and so I think the board needs to make itself more available if needed. And so the first motion is to move to have a regular meeting scheduled the first Thursday of each month. It's tentative in nature.
So how about I just write down
Yeah.
meeting dates?
So meetings,
That work?
yeah. And then if we're going to have more meetings, we'll have more agendas. And that process is a little bit laborious and could be better streamlined right now. So I would just like us to consider if maybe we should hand that process over to our executive team so they can be the point of contact where everybody comes to one person, they have all of the agenda items, so Allison can go to that person, so on and so forth.
Okay, so meeting dates and agenda process and.
Right, and then if we're going to have more meetings, which I think we'll have to, Allison has been a regular attender. We'll hear the financial update, but in the last couple months, we've lost a lot. And so I'm looking for any opportunities I can to help us tighten our belts as we transition. And so Allison does charge us $250 per hour. And we are kind of leaving the more legal focused situation we have before, and now we're getting to a business focus. So I just want us to consider if we think for cost cutting reasons that we could make it through a meeting on our own with our executive team. And that would be a great way that we could come up with some major savings. So that's the third motion.
I just want to make one correction. Tony's name should be by the proposed board of trustees by the
Okay, so is there is there, oh, Carrie has some, Carrie, what?
Chair, you stated, or Nathan stated he wanted to add it between D and E. I don't have an E on the agenda I have.
Oh, yeah.
You have the old agenda?
No, you have the old agenda.
No, I have like 3 agendas, but none of them have an E.
Okay, so I'll just read under, this is under new business.
Right.
So the A is requested HVAC material. The
Right.
B is mill levy education. C is the monument health contract. D is resignation letter. E is proposed board of trustee bylaw changes. And so, but we'll make Nathan's additions E,
Just, yeah.
and then the proposed board of trustees bylaw changes will change to F, and the chiller will be G. So after, is that clear, Carrie?
Yes, thank you, I appreciate it.
Apologize that you don't have the most recent one, Carrie. Sorry.
Yeah, it might, I was just missing the back page.
Yeah.
Okay, so any other additions or changes to the agenda?
There was one mentioned just before.
Oh, yeah, Kathy added Tony to.
Just to Tony, that he's the presenter for the proposed board bylaws. His name's just not on there.
Okay, do we need to vote on changes to the agenda?
I don't,
We should.
I think as long as you can vote for approve the changes to it.
Yeah.
Really approve the consent agenda.
Yes.
The motion could be made to that and those.
Yeah, okay, so do we have, the minutes? Does anybody have any changes for the minutes? So if somebody wanted to make a motion to include the changes to the agenda and to approve the minutes, I would appreciate it.
I move that we accept the additions to the agenda and the August and July minutes for approval. Do I have a second?
I second it. Okay, all those in favor say aye. All those opposed, same. Okay, do we have any visitor comments? Back to you guys again. Okay, so.
I'd like to introduce John, which I think almost everybody in this room has met John. So this is John, JT, we call him, Sweeney. And he has a little bit of a report about what he's been up to the last couple of weeks.
Sure. So first, thank each of you for the opportunity to serve. I know that came with your approval and blessing, and I do appreciate it. And we have a lot of work to do together. There are a lot of items, and I know the agenda's long. I'll make this quick. You'll hear a lot of things. There's going to be more conversations that need to be had. First, I'd probably say that I want to thank Kathy. She's been very opening. All the conversations that I've had in the community have been very positive about Kathy. The people in the community feel very comfortable and very blessed and fortunate. And I feel the same way about the opportunity to work with her and serve under her and support her and her team. So I believe that we're headed in a good direction. Working with the community closely and having conversations, I have, heard and expressed a desire for people to just give you all an opportunity and some time to make some changes and get some things done. We need some time, and you'll see that as we go through today. We are working on a lot of action items. There are a lot of policies. We're doing a lot of auditing. I think for our team, Charlotte and Hannah here, there's a lot of auditing, a lot of stuff that is not in place, that should be in place, and a lot of documentation that is somewhere. But we'll be where it needs to be once we get the proper flow. So we are creating new policies that we will be submitting that are important, whether they be photo release or conflict of interest, implementing changes to our HR approvals, putting some things in place. There haven't been a lot of metrics, and though it's kind of hard to run a department or an organization without reports and metrics. So we're trying to get all of that done and get all of the policy reviews up to date so that we are not sitting with a bunch that need to be worked on. We are in the process of the 9/9 audit. There's been a lot of back and forth about how everything should be kept. We're putting a procedural guide together that no matter who's in the chair or who's in charge, this is the way that we're going to do it in Weston County moving forward. So we are changing and auditing our I-9 process and also our internal controls. We do know that we have had payroll problems. We have timekeeping problems. We have software that is not working together. And it has caused a lot of issues. We are working on a process and a solution, whether that will be getting into work by force or moving to a different timekeeping or a different system. I will say that one of those, something has to happen, because it is a lot of extra work for my team and for Alicia and payroll to try to make those corrections. A lot of times they're happening, but we are putting in better auditing measures for the payroll that I'm taking responsibility of. I do appreciate John. He's been really helpful as well. We've just gotten into it together, getting in, wading in. But there needs to be a little bit more audit in the process prior to its processing the final letter. And so we're going to start doing requests and change requests. We've got a new performance action sheet that we're going to be putting in place that will have any change that happens throughout the organization for an employee. We'll have to go on that, and it'll have to be signed by managers and leadership, and we'll have a better chain of custody moving forward, and everything will track back, and we'll be able to see all the changes, any time changes or any manipulations, and that audit process will help us. So we're working. We know that there's been a PPL balance and EIAB balance issue because of the timekeeping systems, because we have the timekeeping with UKG and then ADP, and there's been a conflict. I believe we have it to its remedy. We're getting ready to upload the new spreadsheet, and hopefully the systems will match and the employees will know where they stand, and we'll get ourselves in a better spot. We have no position control to guide departments and managers with their FTEs, no budgeted FTEs that I can find, so we are in the process of creating position control throughout the hospital for every department. That will be a budget that if there were to be any changes to those positions, it would have to be through a process for approval and those requests. So we are working to get our staffing to make sure that it is in line with where budget needs to be to run our departments and our staffing and our clinical work, that our ratios are right. Benefit enrollment is coming up. We have to make a decision very soon. I had a conversation with Gallagher today with our team. There are a lot. Our benefits are wonky, if that makes sense. It took me like an hour to realize that there's something way off with our how we have it set up, our equations, what the EE and the ER, how much we're contributing, how much the employees contributing, the HSA volumes. You know, it needs to be overhauled, so we're going to come up with a couple of solutions that I think would whack the prices way down. And there are some things that we can do so that we are working with Gallagher to come up with some solutions, because at this point, we're looking at possibly a 20% rate increase this open enrollment. So the employees and the organization, and I don't think the organization is in place to take the hit, and the employees aren't in place to take the hit, because it's some of the most expensive insurance that I've ever seen. And I did learn today that the Mountain Belt, Wyoming, Montana, Utah, we have higher rates because we get paid better, is what I was told from our service. So it said 50% pay to claims. We get more like 75, 80, maybe more, and that is negotiated with the carrier. So we are also going to be looking at Blue Cross Blue Shield and see, I don't want to hurt the hospital cash flow, but an EVS worker cannot afford $1,300 a month for health insurance. So those are the concerns that we have with the benefit enrollments, and we have to check and see. We also are seeing a reduction in users or those enrollees, and then also because we have that self-pay plan, It spreads the cost over fewer. The more people, if we can make it more affordable, the more people we have on the plan, the cheaper it will be as well. So the other thing is we're spending about $207,000 on HSA contributions, 46 employees. And there are some options that we can look at with that would probably be better, and Kathy can talk more about that. I'm also reviewing the EIAB, which is our extended illness benefits. I don't know how, I've never seen anything quite like this, so in investigating, we do not have a short-term disability or long-term disability plan like through Lincoln or Mutual of Omaha. We offer this extended illness benefit that can cap out at 720 hours, depending on how long an employee's been here.
Which is 90 days for an 8-hour worker.
Yes, and then they can have up to 300 and some for their PPL or paid off time. So when you look at the numbers, up to almost 1,000, somebody could be off almost 6 months paid, and it's a lot. I think that if we look at and we're working on that, John's helping me. If we look at the calculation there of what the cost of the hours that are in that bucket for the EIAB and what we're paying, I think that we would be better served with a long-term or short-term disability plan that the hospital pays for that will cover our employees for FMLA and for these kind of outs, but not cost our organization the exposure that. And I know that is going to be a difficult thing because it's been in place for a long time, but with some of the conversations that are coming up about cost-saving measures, we will need to do some of these things for the organization. And I think the people are more interested in having committed employment and being able to understand. And we can educate short-term disability and long-term disability. And what we will do, we usually know now, we will roll it all into one. So our volunteer life, our basic life, our accidental death and dismemberment, it'll all come under one and it'll give us a better rate. And I am almost 100% that it'll be a fraction of what our exposure is with the extended illness benefits that we offer or that we have in a bank. We worked on mill levy education. I think we're at the point where it's ready to go out. That was one of the first things that Kathy asked, and I'm happy to work with that. I've been telling everybody in the community, vote. Your amounts aren't going up, it's the same. So I'm happy to be involved in that. We're working with leadership and management development. I've had a lot of the last 2 weeks taking time, and I know I'm taking a lot of time here, and I'll shush. A lot of time with managers because there's a lot of things that have just not been done. And there's been a lot of managers that want skills that don't have them. And so a lot of the disciplines we've taken back so that the process that I've included now, because a lot of steps are getting missed, and I don't want us to face EEOC or unemployment issues. And so I think most of the managers have been very thankful that they've been able to use me as a resource when I'm sitting in with most of the employees now when they're in either. I've been on many of the last 2 weeks, disciplines and consultations. One of the things that Tony, and I appreciate him, pushed rounding. I've been doing a lot of rounding. It is shocking that the people are confused when I show up and they want to know if I need support at the acute desk or long-term care. They want to know what I'm doing there. And I said, well, I'm just coming to see if you guys need anything. They said, well, only Kathy's ever done that. So we are going to get people used to having us with them. Whether it's at home health or at the clinics, and so I appreciate that, and I appreciate the welcome. The last thing I would mention is the integrity and confidentiality. I did, Tony put out a survey for HR effectiveness. There are some key points that the managers said were good, and there are some key points that need to be improved. We're working on those. Confidentiality is one of the lower scoring, so we've already made some changes. We had some offices shared that shouldn't be in the HR setting with conversations going on with multiple people at one time, and so we've already made adjustments there, and we are making some further adjustments to make sure that our confidentiality is top notch. We are working to rebuild the integrity of our department, and I believe that the employees are seeing a difference already. Our strengths, these are from the managers that were polled: onboarding, accessibility, and with it, I think they believe the HR department is supportive, but again, the confidentiality and sometimes the attention to response times have been low. So we are working, and we are getting better and better every day. And I just am thankful for the opportunity to serve. So,
Could I, it's over here, could I say one thing? Carrie, I need you to help me remember something. Do you recall in a prior meeting during Randy's tenure that we talked about the vision insurance and that our local optometry place?
We did.
Yeah, and do you remember the name of the insurance that we have right now? Can you recall?
I think it's VSP.
Well, yeah, right. So I had my kids in there, and they just told me that the plan we have now, I can't remember what it's called. It's not so helpful to the patient, and they won't accept it.
correct.
But that all the major employers in the area are using VSP, and they just wanted us to know that. And so I just wanted to mention that to you.
Hannah is working on
Okay,
that as we speak
great.
to get us.
Well, actually, she's sitting in here.
Well, in her mind. We are working on that. We've met about that this week. So that is on our radar. Thank you. And feel free, anything that is needed or any questions. I don't have all the answers yet, but we're getting them.
You mentioned the mill levy ballot. I believe, but it should be checked on with the courthouse and our county clerk, that the wording on the ballot will be, instead of additional 3 mills, it'll be a continuance.
Continue, yeah.
And I think if we verify that with the clerk, that would clear up a lot of misconceptions. People, you got it.
Yeah, I think
Okay.
they corrected
Continue,
that.
yeah.
Okay, good deal. I like.
I appreciate
I
that.
think that's a great suggestion.
Well, I didn't make the suggestion. Well, we talked about it in our meeting.
I remember that.
And it was visited with the clerk, but it's not
Yeah.
my decision to go ahead and tell the clerk what to put on.
Right, thank you.
We do appreciate that though, because that does make a difference because of the confusion.
It makes it more clear.
And the clerk kind of had it all spelled out.
Okay, anything else for JP? Any other questions? It's nice to hear from us.
We're gonna get there.
Okay, so, finance, now we're up to.
Thank you. Yeah. So our finance committee met on Tuesday night. We really have 2 focuses. We're looking ahead, trying to get the shop in order, but we also have to look backwards because we're a little delinquent on some of our reporting in order to get financials. So I put together a summary that I went through with the finance committee. We don't need to go through it in the same detail tonight, but I wanted to hit what I think are the highlights of my financial report.
Do you want me to pull it up?
Sure. And I'll just keep chatting while you're searching. So the first thing that we discussed was our audited financial statements for 2023. We've not issued them yet, so they're about a year and a little bit more overdue. But we've been working on that, and the good news is we were told on Monday that we would have a draft of those audited financial statements within 2 weeks. So we're already a couple of days into that. So we hope to have a draft very, very soon. The little table, if you could read it, even though we don't have the draft in our hand, I managed to get the final audited trial balance, which we don't believe is going to change anymore. So we can start to talk about the 2023 results. Good job, Vince. And so if you look here, we have a 4-year summary going back to 2020 up through the preliminary 2023. And you can see that in years gone by, there's a pattern. So we always had a loss from operations, 1.7 million, but that loss is increasing every year up to 2023, where the operating loss will be 4.5 million. And we had non-operating revenues to offset the loss, such that in 2020 through 2022, we always ended with a positive bottom line. Now, in 2022, it was very close to break even, but it was still positive. In 2023, right now, the trial balance has us at a bottom line loss of $2.3 million. So that's about a $2.5 million swing from where we ended up in 2022. So if we do some variance analysis on that swing, breaks down this way. Our revenues between 2022 and 2023 are going to be down $1.4 million, and that's all sources of revenue. And our expenses went up $1.1 million. So it's not what you want to see, but those will be the audited numbers. I suspect that the next finance committee will have that draft to share, and then sometime after that we'll get an additional final. But the auditors are very comfortable with these numbers and don't expect them to change. Next thing that we talked about, very important, and now that we have the 2023 audit just about behind us, we need to start the 2024 audit. That's a little bit more complicated because our books and records are not in good shape.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
That's a little bit more complicated because our books and records are not in good shape. We're getting a little better every day. We're getting a lot of help from Durban with their accounting staff in doing balancing and reconciling and reviewing transactions and doing analysis that will turn over to the auditors. But we still have some way to go. I'm not exactly sure. I should be able to be sure, but I'm not yet exactly sure when we'll be in a position to turn over 2024 to the auditors. But I would say probably 60 days at a minimum, something like that. And then we'll have that reconciled, and I'll be able to come to these meetings and at least share some preliminary 2024 information. One of the biggest problems for us, and it's maybe the item I worry about the most right now, at least if you scroll up right there, item number 4, is our Medicare cost report. So Medicare is extremely strict about filing the Medicare cost report on time. It's due November 30th, except this year November 30th falls on that weekend, so we have till December 2nd. But to get that cost report done on time, we have to complete our audit. We have to give the cost report preparer the audit, and then they need time to work through the cost report, which is a fairly complex document. I really don't think we can do it, so we need an extension. CMS is about as stingy with an extension as you can be. As you can imagine, with 5,700 hospitals, opposed to, that's just the acute care hospitals, they can't have a lot of extensions out there or they couldn't do their business. So what they tell you in the instructions is they'll only grant extensions if the underlying circumstances are outside of the control of the organization. I'll give you examples, like a flood or a fire, where you have to transfer your patients to another hospital. So we don't exactly hit that standard. But we've had a situation here which frankly left us with the equivalent result of having a fire or a flood. So I've been working on a letter. Kathy's reviewing it. It's in draft form. I sent it to the accountant that's doing the work for us, writing up 2024, and asked her if she had anything to add to explain in some detail exactly what we're confronting here. And we'll get that out probably early to middle next week. I'm asking for 3 months. There's no way they're going to give us 3 months. I'm hoping they give us 2 months. They might give us 1 month. They might give us nothing. If we can't extend it and we can't file something, their remedy is they start to reduce your Medicare payments. So they have the authority to stop your Medicare reimbursement, which would be devastating. They have a fallback, which is they could pay you at 50% of your Medicare rates until you get your report. I really don't think in my heart that they would do that to a critical access hospital that was struggling. I really don't think so, but I may be naive. I'm hoping they give us some amount of time, and our fallback could be we'll file something. So we'll get as much information as we can into that report. We will disclose the estimates that we have to use, and we'll file it, and we'll keep working on the real thing. And, you know, it might be a little bit ugly, but we'll get through it. But that's a concern. I've been told, and I don't know for a fact yet, that some years back, we also had an extension. And that also works against us. So if we've come back, they're gonna wanna know why with 1,200 critical access hospitals in the country, why only one, or maybe there's another one, maybe 2 or 3 are asking for extension. So we'll see. So I just want the board to be aware. We'll do everything we can to try to not incur a penalty and to get our report in on time. But this is a tough one. That cost report is probably 150 pages. And a lot of statistics and calculations, and you have to do it right, because the way you fill out that cost report directly impacts how much money you get at the end of the day from Medicare. So today I looked at the last year's Medicare cost report, and we actually got a substantial amount of money back, but hundreds of thousands of dollars, meaning Medicare underpaid us throughout the year. We completed the cost report, and it showed they owed us more money than they paid us, and they write you a check for the difference. So we want to be in that position again, and we'll see. But there's science behind the Medicare cost report. So how you fill it out, and it's not, there's nothing wrong about it, but how you fill it out, the statistical basis you choose to use to allocate different departmental expenses will affect the outcome. And so, you know, we need to take our time and do it right. So that's the Medicare cost report.
Can I ask a quick question?
Yes, please do.
So what is your realistic expectation of when you think
So
that could be done?
What I told them in the letter, what I'm describing in the letter is that we need 60 days to complete 2024. The persons preparing our cost report have told us they need 60 days. So, and then we're going to go right through the holidays. Those months, the month of December is like half a month. So what I've asked them for is to the end of February. I really don't think we're going to get that. I think maybe we get 60 days, possibly 30. If the person's in a bad mood that day, we might not get anything. So it's a very fluid situation. And one more thing, we have 2 different fiscal intermediaries that we're dealing with. So Novitas is the fiscal intermediary for CMS for the rural health clinics, and Meridian is the intermediary for CMS for the hospital. And so I have to actually have 2 letters, and we need 2 firms to go along with some kind of an extension. Yes, I'm sorry.
You talked about not meeting the deadline. Will they allow a amended report?
They do. So it's not uncommon. So if we filed a sloppy report or a report with estimates in it, we absolutely have the ability to reopen.
Okay,
So
and there's no penalty for the amended?
Not for reopening.
Okay.
The only penalty would be if we filed a better cost report and it showed we owed more money. You know, there'd be some interest on that.
That's not owe you money.
And I think the last point from the Finance Committee worth sharing with the board is that we're going to go forward with a charge increase. Now, this is built into the budget, so I don't think we necessarily need approval tonight, but I just wanted to make the board aware that we'll be doing something along the lines of 5% charge increase, but rather than do an across-the-board increase, we're going to look carefully at our charges, focusing on the procedures that are sensitive to consumer pricing concerns. So radiology is a perfect example of that. So we'll look at the prices, the price list of some of the freestanding radiology centers than the other hospitals in our vicinity. And we'll make sure that we don't price ourselves out of the market. Lab could be in that category as well. So the increase won't exceed 5%. Some services might be less than 5%. So, Denise, why don't we, any questions on what I've covered so far? So, Denise, if we have this cash flow, yeah. We also shared at the Finance Committee some trending. Because one of the concerns we have is the trend in cash. We're going to make that a little bit larger. And so the top schedule, this is the last 5 months of our cash flows. And so you can see, reading on the left-hand column, this is the inflows of cash: hospital, nursing home, rural health clinics, credit card, and IGPs and other grant revenue. So our inflows, you can see in April were $1.9 million. In August were 1.5. Down below, salaries and benefits and our non-salary expenses, the outflows went from 1.7. In August, they went up to 2.2. Now, there's a lot of noise in these numbers. So in August and even into September, we've been catching up on some delinquent invoices. So the numbers aren't clean and they're not exactly comparable. But if you look over the 5-month period, we've reduced cash by about $300,000. If you go down to that next little chart, September's not a completed month yet, but on September 16th, which I guess was the day before the Finance Committee, I looked at where we stood with September cash, and you can see it's down to 5.2 million. We did a lot of cleaning up of old invoices in September. So again, not necessarily a pattern that you can say is going to repeat every month, because we have a lot of expenses that are out of the correct period. But generally speaking, cash is moving in the wrong direction. This 5-year look back on cash, you can see in 2021, our cash was $14.1 million. There's a lot of non-operating revenue, one-time, non-recurring revenue that's in that number, much of it related to COVID. So we've got advances from Medicare, just flat-out advances that we had to pay back in later years. But we also got $4 million of grant money that we held on to. And we had $1.8 million of a small business loan that was connected to the COVID situation that we also were told we could keep the money. So we were kind of flush in those years. But you can see now that we're spending that back down. If you go to the years 2019, 2018, prior to COVID, we were getting along at $1 million, $1.5 million in cash. And I understand there were some periods in time when we got very, very close to not making the payroll. Then we went into this 3 years with COVID. We did well, we had a lot of cash. We are now trending back toward 2018, 2019. And the fact that we're losing money, bottom line, is that loss is basically made up in cash. So we have to keep a very, very, very close eye on cash. And we are doing it. So we look at it just about daily, and we'll continue to focus on it. But the key to strengthening our cash flow is to strengthening operations, building revenues, and controlling expenses. So it's helpful to look backwards just to see the direction of the organization, because there's a certain momentum that builds up inside an organization. In our case, it's not necessarily a positive momentum, so we have to control it, manage it. Okay, and maybe the last thing I'll talk about was, unfortunately, this board and the Finance Committee went a long time without seeing operating metrics and statistics. And it's also a challenge to the people running the hospital. We don't have metrics to evaluate, are our revenues in line with our volumes, are our expenses in line with our volumes. You really need metrics. So we've begun that journey. So I was able to put together and then a 2-month year-to-date, first 2 months of our fiscal year, over to the right. And for the most part, we're moving along at the same rate that we've run historically, with a couple of exceptions. Our OBS patients, observation patients, volumes down a little bit. They pay pretty well in the critical access hospital. So even though it looks like our hospital acute days are more or less where they've been the last 3 years, I suspect that some of that acute volume is really a reclassification of the OBS patients. So if you put OBS and acute together, we're probably down a little bit. So that's not a good thing for us. The manor, we talked about what a terrific facility that is, but we're running around 40 residents a day. We have capacity to run 50. The difference between running 40 and 50 is, for the most part, the difference between making money and losing money. And so we really have to figure out a way to get up to our full capacity there and do a little bit of expense management. But when we do that, and that facility carries its weight, including the overhead associated with running it. The clinics were a little bit slow in June and July because there was some staffing shortages over there, provider staffing. That's been restored, and you can see in August, the Newcastle clinic's back up around 700 visits for the month. So that's good news for us. Imaging has remained strong. Clearly a busy service for us and a very solid service for us. The therapies, PTOT, speech, same way, pretty active programs, consistent volumes, and then home care has held its own as well. So some of those non-hospital-based services or those ancillary services are doing pretty well, and those are the services that the community especially appreciates. So that's what we covered. Next meeting, we will have 2020. I believe, I'm sure, I commit, we will have 2024 full-year metrics. So we had a new person start the finance department today. Job one will be to accumulate our 2024 statistics so the board can see what happened here operationally in 2024, which I think we all need to see. So I'd be happy to answer questions. Yeah.
Will at some point in time we be broke down to different segments, clinic versus pharmacy versus whatever, that can be broken down to see what is paying for themselves and what is costing?
Do P&Ls by service line. Yeah, we'll get there. Yeah.
So
very important.
We know which directions to go.
I started to do that. Well, it's two things I would say. In a critical access hospital, that's really not too complicated. Having said that, I don't have it for you yet, but it's not too complicated. So I started to do some of that, and that's why I was able to say the manor, when it gets to 50, we'll cover this big. So I think that's important. And it's just a matter of having confidence in the data that I share with you. But it's not that complex of an organization. So the goal would be to have baseline P&Ls that when you add them together, they equal whatever the revenue was for the month, the year, before.
Thank you.
Okay.
Any other questions?
You're very welcome.
Oh, Carrie, do you want to add anything to the financial committee meeting?
Right, I just wanted to say that the finance committee meeting, on Tuesday was probably the best finance committee meeting that we've had in an entire year. So I want to thank John and his team and all that he's doing to make this happen. As you can see, we actually had some real numbers to look at. We have much more ways to go, but I really feel like the finance committee is making headway because we started the process during the budget where we met with all of the different department managers, and you remember the reports that we brought back to the board where we reported to the board the conversations that we had and that we were trying to raise budgets and the budgeting process to front of mind for managers. And it's really refreshing to see that John has jumped in and already started moving that process forward. So I'm really excited for the finance committee to see this process through and show you some real progress next month. So thank you.
Thanks, Carrie. Okay, so you have a paper in front of you that says strategic operating model consideration. And this is something we talked about in finance committee as well. So I kind of want to start with what the names that we first called this, which is kind of like you're going to fight it out, what we're going to do to save ourselves, right, to be able to get better. We're going to affiliate and or we're going to convert maybe to something else that's more transformational. So it's fight it out, transform, or affiliate. And I personally believe affiliation is really not in the vein or blood of the community, so that's probably not realistic. Our current model has a declining financial profile, and if you really look at it, it kind of is mimicking what was going on in 2018 and 2019, and I think when they got that flood of money, something happened that they didn't realize their model still had some challenges. So we have some staffing challenges always and constraints there. Low inpatient census is part of our challenge. We have administrative complexities, that's what we called it, rather than something else. And recruitment and retention of staff is something that's very important to us as well. So on this current model that we're on, we really are talking about right now why we're talking so high level but critical with you all is because we really are sitting at about 7 months worth of revenue of operations, of cash, thank you. So that's not a lot, but it's not the end of the world either, right? We just need to get on top of it. And some of the ideas that we came up with was looking at this idea of converting to what's called a rural emergency hospital. So there's some very big advantages to it. We still are learning a lot about it. We just went ahead and contacted the group at HRSA that actually helps provide you the help with feasibility study and all of that goes with it. But essentially what it does is it allows you to retain all of your outpatient services. So everything that we have in home health, everything we have with radiology, PT, OT, speech, home care, those products, the clinics, the manor, yeah, those can all stay in place. What it does change is that we can have patients in the ER and we can have obs stays. Now, observation stays vary for how long people can stay in observation. It's still an average, and it averages anywhere between 24 to 72 hours. Every once in a while you get somebody for 96, but that means that people could stay here if we thought they could be going home in a day or two from their services. So we could still have beds to be able to do that. The buy-in to this is that Medicare actually pays you $276,000 a month or $3.2 million a year to be in this program if we would fit into that program. So rather than losing some money, this is money that we get that's basically given to us for going into this type of a model. So $3.2 million is a good amount of money to be able to help support our organization. And I would say to anybody that's worried, not that we don't know this model completely. I have read I will share it with you in my email for the week, but I read an article. It gives you the pros and the cons of the voice of the REH CEO. And so I'll send that to you all so that you can look at it. The big thing is communication on it, getting the community to understand it, getting the board to understand it, getting the staff to understand it. The truth is, our model really looks like this already. We really don't get that much in the way of acute care patients. And if we have anybody that's suspected to have a long stay, we transfer them to Monument Health. That's what we've been doing for a long time. I looked in our books, and those transfers that we've made have made sense to me. We've kept the ones we could keep, and even with keeping the ones we could keep, we don't have much in the way of acute care bed need. So to have those acute care bed needs may not make sense to our model, because we really could probably function very well under an observation model, where the person would know the difference, whether they're in observation or they're laying in a bed in an inpatient stay, to be honest with you, because they get the same care. It's just a matter of how we bill for it, and the way we have to look at the number of hours that we can have a patient. So I'm not saying it's all simple, but that's kind of giving you a real quick breakdown of it. I think that we believe that might transform us, and there are actually case studies out there that they've done with this, where people have actually ended up making more money off of that type of a model, on top of the $3.2 million that they can get from Medicare. So we would like to do a feasibility study on that. I've already taken the liberty of checking out the organization a little bit that does that with HRSA. And they're very happy. They answered us right back, and there's absolutely no cost involved in the feasibility study. So it's a matter of a process, and that process may tell us that that's not the model for us, but I don't believe that it will. The one thing that we want to do is then try to pick up more of our outpatient opportunities for service. So we may have to think about remodeling an area so that we can have a procedure room and do endoscopies and things like that. We might down the road a ways, because we've got some money to deal with right now. But maybe we could have a surgery unit for small procedures for somebody to be able to do those within the community. And a lot of times, a lot of those kinds of procedures that we would do here are outpatient services types of things. And at the very most, people stay overnight. So we're saying that we call it transformational, because quite frankly, it'll transform us from where we're sitting right now into potentially something much better, and better for our community. And I can't emphasize enough, I know we all have our different opinions about the mill levy, but we really can't operate without that mill levy this next year very well at all. And so we do have the brochure, and you could roll it up if you'd like to. We do have the brochure, but we are going to get some put together and folded and that sort of thing. I'd like to be able to get some out to you all as well. We're going to get them out all over the community. We're going to go to the senior center. We're going to go to the town hall for our staff. My time this month has been very busy, very, very busy with finance and orientation and dealing with all of our different things.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
My time this month has been very busy, very, very busy with finance and orientation and dealing with all of our different things. So late September, early October is when I'm going to make those visits to make sure that we get that message out to people. That's kind of what it looks like right now. I put a special message for me on there, and then we kind of just said, your vote to continue existing mill levy safeguards essential funding for your local health care facility. This is not a proposal to raise taxes. So the other thing I put in, and part of that is, while we have experienced a loss of trust from some community members, I'm here along with 200 employees asking you to support us by voting for the levy, and we in return will focus on continuing to bring high quality health care to you while demonstrating fiscal responsibility. I think that's the message they need to hear, is that we want to bring high quality care and fiscal responsibility that they can visibly see happening as we move forward.
That looks really nice.
Okay, all right.
One quick question back from this.
Mm-hmm.
Did you find out what the state thinks about this?
I went to the state, and I went to Wyoming Hospital Association. They said a couple of hospitals looked at it. They didn't do it. They did it kind of on the back of a napkin, is the way they said it. So they didn't do a full feasibility study. I can't find anything, but I didn't get anybody at the Department of Health yet that could tell me that this is allowed or not allowed. So that is one of my hoops I've got to get through, is will the state of Wyoming allow this type of
So no one in Wyoming has done this yet.
Nobody in Wyoming has, but they've done it in several other
I
states.
think there's a total of 32 of these conversions around the country.
Okay.
Most seem to be concentrated in Texas and Georgia. for some
Okay,
reason.
Texas, Georgia, Pennsylvania,
Pennsylvania.
Pennsylvania, and
And
Kansas.
they were
Yes,
all
Kansas
pretty
as
much
well.
changing from critical access hospital to this rural emergency.
Kansas, yeah. So, I mean, it will take partnerships too. It's like if we change our model, we're gonna be talking to Monument Health about how they can maybe do a little bit better job by us for the lab, and we can do a better job for them by our admissions that maybe we are not gonna have or something like that. But I think that those kind of partnerships can be very valuable to both sets of teams. And I know it's a lot to think about, so I just want you to think about it, but I would actually like a vote to say whether or not you approve a feasibility study on doing this kind of thing.
So there was
moving
no
forward.
cost. What are they going to, I mean, like, what's the time frame? What's the?
Don't know all of that yet.
Yeah.
Okay.
We don't know all of that yet.
We filled out the form to say we'll probably be requesting a feasibility study. The people that do it are persons that work for this company, but also a lot of retired executives from critical access hospitals that
CPAs.
just want to help out.
They're
So,
mostly volunteers
Yeah.
who
Mhm.
care about
Yep.
small
That's exactly what it
hospitals
is.
surviving. And I found a YouTube video, I sent it to Green, I'll send it to anybody who wants to see it, but it was an interview with, it was an organization, I think it was RHRC, but.
That's it,
Yeah.
rural health. is
Yeah,
something.
and so they just interviewed the CEO, I think it was South Central Kansas Hospital.
Yeah, there's a Kansas
Yeah.
hospital.
And just asked the CEO, you know, you did the transition from a critical access hospital to a rural emergency only hospital. And how did it go? Tell us about the process. And he said, they had similar numbers to ours. He said they lost 3.7 million their last year as a critical access hospital. They switched to this rural emergency hospital designation. And it worked fine. He said it took 6 or 8 months from the time you file the paperwork until it's approved. But the process worked, and they're back to being very successful.
Yeah.
So I'm happy
Yeah.
to send that link to anybody that wants to watch that interview.
Transformative things does take a lot of work because you're gonna try to do something outside the box of what people have done in the state or done someplace. And so there's a few questions we still have to get to. But what I will tell you is that doesn't stop us from doing what we're doing today. So we're still gonna have to fight it out and at the same time do a feasibility. So what we're saying is we're gonna try to do double the work to try to be able to make sure that we do the things we need to do to correct our situation financially.
I just have one question. What's that gonna do with staffing? What is that gonna do for the acute care nurses?
Well,
I mean, I know you're gonna have obs beds, but you might not have that every day.
well, there's swing beds still and there's swing bed intermediate, and that's what they do most of the care for already. So,
This says you lose swing beds.
no, you don't, because we'll pull them up under the manor.
Yeah, we lose
Okay,
the,
because it says exit acute care and swing beds on the
so
top of this.
we lose the swing beds, which are intermediate beds located in the acute hospital.
Okay.
But most of those patients can be
Skilled.
patients of the manor. So we lose the beds, it's a little bit technical, we lose the beds, but we don't necessarily lose all the patients. We'll lose some.
Nor do we lose the revenue, because what happens is that it's called skilled nursing care. They have so many days of skilled nursing care, just like we have to worry about. And they just pay you on that rate. So, if we don't, I don't know who's like, sorry, Carrie, if we don't, turn things around with some dramatic changes, there may be dramatic changes we don't want to make, and that includes the staff. So I'm just being very, very honest about that.
Yeah.
So, I'm trying to figure out a way to go down two pathways with my team, and we're trying to figure out a whole lot of ways that doesn't include employees being cut out of the picture. Because, but I can tell you the current model probably can't stay that way. That's just being honest.
It's my opinion that John, I'm sorry. Oh, Carrie, I didn't see you. I'm sorry. Go ahead.
Go ahead, Carrie.
So I just had 2 points and one question actually for Kathy and John. The rural emergency hospital, I think, is a fairly new classification
Yes.
for CMS, and this is a fairly new thing. So the fact that there isn't any in Wyoming isn't because it's been around forever and no one's decided to do it. It's because it's a fairly new model. And the second thing is, by doing this, it's sort of a transformation of and a reclassification of the things that we do now. So swing bed wouldn't go away, would just be called an ops bed or a skilled nursing bed. The care that we give isn't going away, it's just reclassified into a different bucket. And it's sort of the same thing with our staff. I don't really see us losing any of our staff. I see us reclassifying and reallocating them in a different direction. So I don't see that our number of employees or anything like that would change. They would just be reclassified. Does that make sense?
It does make sense, and that's why, as Kathy was describing, we become more of a health village. So we'll try to put in eventually an interventional minor procedures room that's going to absorb some of the staffing. We'll lose a few patients. There are some acute patients that are genuinely acute that might be destined to stay 4 or 5 days. They really won't be able to be here. They'll be here a day or two, and then we'll ship them out. So we won't keep 100% of the patients. We'll absolutely have some attrition to patients, but the hope is to more than make that up with other services.
And you have,
I'm very curious about how that feasibility study is going to come out,
yeah.
because
Yes.
we'll be paid differently.
I
So
thought Carrie had a question also, she
Do you have a
said.
question?
If the board is ready to vote, I'd be happy to make a motion for Kathy and her team to engage in a feasibility study.
Why don't you wait just a minute, because both Ted
Sure.
and Nathan had something to say. So Nathan, you go.
This may have already been mentioned, but if we wanted to in the future, we could always change back
Yeah.
to a critical access hospital. So this is not an irrevocable choice.
I forgot to mention that. You're absolutely right.
On the backside of the feasibility study, okay, somebody pays for the feasibility study at some point in time.
No, this
No,
is.
this
I know we said no cost, but
Yeah.
is there a balance at the end of it? Somehow or another, there is a cost.
I don't expect.
Not from any place nothing from I've read from so far. It's literally no cost.
It sounds like it's volunteer.
It is largely volunteer, right? And
They have places, people that donate to it and stuff as well, but
yeah.
it's a HRSA program. So HRSA programs usually have funded money towards them. All I know is they told us there's no cost involved.
Very
Now, this is, CMS recognizes the importance of rural health, and they recognize the struggles of maintaining rural health facilities. So that whole concept of swing beds, which I think started probably in the late 90s or early 2000s, was a way to use excess capacity, and then they ran it through the Medicare cost report, which gives you opportunity to optimize costs. And that was all done to get cash flow into critical access hospitals to keep them afloat. But I think in the last 5 or 6 years, a couple hundred critical access hospitals, maybe it's a little bit more, maybe it's 10 years, 250 or so critical access hospitals have just gone away, and they don't want to see that happen. So these rural emergency hospitals are another attempt to make a systematic change to try to keep these facilities afloat, because they recognize rural communities need health care. And so if it can't support the acute, let's expand and fund this emergency model, because we want to keep these facilities alive.
Will that report also include what Medicare may or may not pay with the change, what the state of Wyoming may or not? I know
Yeah.
it may not be state
So Medicare is very clear about what they'll pay. So they have a prospective payment system for outpatient services called APCs. They'll pay this rural emergency department 105% of the rate. Now that sounds great, except that rate isn't equal to what we get right now under the Medicare cost report, which is cost-based. So there's pluses and minuses to me in the economics, and I'm very curious to see where it all falls out.
Okay, and that report will tell us.
And that's why they give you another, it's 276,000 and some change per month. And that changes every year with a cost of living adjustment. And so they give you that to make up for some of the overhead that the Medicare cost report picked up in the past.
On the
So-
acute care nursing side, these little hospitals actually increased their RNs to 3 RNs for the ER, because I think their ER got busier and their observation stays with it. So they actually had the nurses repurposed, I guess is the word to say, to that ER acute care side just differently.
And perhaps some can help us keep open some more beds in the manor.
Mhm.
Speaking just from personal,
Mhm.
there's some acute care nurses that don't want to work in the manor. And it might be a hard pill for them to swallow if they, even if they're going over to skilled swing bed. But to transfer from acute care, because it's a whole different kind of nursing. And I'm just saying that sometimes it's kind of.
I don't think they even have to change where they're working.
So
I think they
could stay here.
They could stay on their side of the beds, that would just be the swing bed.
Okay, well,
Yeah.
that makes me feel better because.
Yeah, they
I
wouldn't
mean-
have to switch over to the manor, because I'd still like to fill that with 50 beds of the manor
Okay.
patients.
Okay,
So
I didn't
skilled
understand that.
and
Sorry.
intermediate would still stay right where they are. They just would be paid under the manor buckets.
That's what, when we were talking about it at the finance committee meeting Tuesday, it felt like what they were describing with this rural emergency hospital, like I don't want to just be in an emergency hospital, but at the same time, what they were describing feels like what we already are doing.
But I just had
Yeah.
to say that.
Yes, you say, it's good,
It's
I had
good
to
because
say
we
it.
need the next, I mean, we just, like, we don't have to decide right now.
Right.
But we need to be talking about it and figuring out what's best.
I think there's no drawback to the feasibility study. You just have that done and then we have a much better idea.
Another graphic.
Yeah, we do have another graphic. I put it on your piece, but this is kind of what the transformation change could look like. Specialist physician access, home care, pharmacy, the therapies, rehabilitation, and minor procedures, emergency care, laboratory to manor, and rural health clinics. So, it really could end up growing.
And it
Just a hypothetical, but that's an example of, I call it the health village, turning this place into a health village.
like, well, what it felt like is it would give us the opportunity to help what we already do relatively well, help us get it better. That's what it, that's what it seemed like, and maybe we're just being over optimistic and, anyway, but it did seem that way when we were talking about it at the
Well,
finance
hopefully it
committee.
makes us better, but also at the same time it keeps the hospital open.
Right, exactly, and
That's,
that's what we need so badly. That's what at least for me, we need the hospital here to help these people that we need the manor. And we need these people that are coming in with a car wreck or a motorcycle accident or a horse wreck or a stroke. Yeah, I mean, that's what we need for our community, is to have someplace where they can get help right now.
Well,
And the majority of people go home in our book, and then we have transfers. There's very few admissions, to be honest. So it really is transfer or they go home.
yeah.
And,
And like you said, I mean, some of those people could be observed for 24 hours and then,
mhm.
I mean, that's kind of,
A feasibility study like I think doesn't do anything except keep us a lot busier, and it doesn't cost you anything. So it at least gives you another option. All of us another option. We can weigh it out. We may find out it's not a good option for us, but we may find out it's a great option.
I believe in that option.
Yeah.
I would definitely say we could,
Madam Chair.
if you
Oh, did Carrie want to make?
I think-
Okay, sure.
So Carrie,
No worries.
you're ready for your vote.
I just wanted to make one last and final point. And that is, we focused a lot on the inpatient and how something like this would change the inpatient side. But if you think about the majority of the healthcare that we deliver is on an outpatient basis. So if we can expand the community, the availability of outpatient services to the community, expand our clinics, bring in more specialists, bring in more services where people wouldn't have to leave Newcastle to go to Rapid City for a test or Gillette for a procedure. If we couldn't do more on an outpatient basis to help our community to be able to stay here in the community, we're actually doing a far greater service for them. So looking at this model, it may allow us to do that, to just serve more residents with more Weston County residents with more services that they wouldn't have to leave Weston County to get. So.
Okay.
So I think if you want to make a motion, you can, or if you don't, Nathan will. Okay.
No worries, either one is fine with me. I'd be happy to make the motion to allow or to authorize Kathy and her team to engage in a feasibility study for converting to rural emergency hospital.
I'll second the motion.
So Corinne seconded. Do we have any more discussion? Okay, all those in favor say aye.
Aye.
All those opposed, same. Okay, so
Okay.
the motion passed.
I just have a couple more things. We have an EAP policy, that's for employees assistance for program for mental health, wellness, behavioral health, whichever word you're used to. And we have actually got a proposal that we were just sent, but I wanted to let you know that we have this policy that says we'll provide that service to our employees.
That looks so good.
However, we do not have any of the framework. So we are looking at providing the framework. So what I'm saying to you is we have no services that we had
The policy
connected
saying we'll do it,
with,
and we don't.
and we don't have anything. So we now have a proposal, we'll bring that back next month, but we do have a proposal and we'll look at a couple other ideas for what we can do for EAP, so that our policy, we can follow it. We've had people we've offered it to, and right now we've just used Volunteers of America to see if we could do that, but we really need a more formalized policy relative to it. I will be talking about the chiller later, but just know that I'll need a vote on that.
Cut in front of it.
The community health needs assessment we'll talk about later too, but we'll need a vote on that. And we're gonna do a little bit more revenue cycle evaluation. I won't say more than that right now. It's just that right at this time, we're struggling because we have two of the key people for some of the billing and stuff out. We've actually got 3 people out of the business office right now, and that's a pressure. So we need to come up with alternative plans when it's like that.
Temporary out or?
Temporary out, but out a long time. So you know what that looks like. That's not good. We need except for Carrie and Ann, we need the date of birth, social security numbers, the county you were born in, the state you were born in, and your name. And the reason we need all of that, I forgot. Why do we need all of that?
Picos.
Yeah.
You
No,
need it
Pecos.
for Medicare Pecos.
Yes, Medicare Pecos.
Provider chain of ownership.
Yeah, so if you guys could somehow take and put a paper around, I don't know where I could get you a paper. Here, just do it on the back of this. And those of you that haven't done it, sorry, you have to put your name down and where you were born. And so it's your date of birth, your social security number.
We need to do this in handwriting,
Yeah, well, you can send it to me otherwise if you want.
which is an alternative to us writing it down. Could you send us a reminder email?
Yeah,
Do we all
as long
reply?
as you all reply.
Yeah.
Okay.
I think it's
Name,
probably
date of birth,
better
social
to be
security number.
Yeah, social security number, county you were born in.
private.
Yeah.
Have all our
State
social
born in.
security numbers on a big old list over there.
If I was you, I'd write it on a paper and hand it to Denise, and
That's
then she
great.
could put it in a shredder rather than send it.
Well, I wanted to
through
start
email,
over
but
here,
that's
so it
just
goes
me.
around here, I can get
Yeah.
a copy of it.
Go ahead.
So it's date of birth, name, date of birth, social security number, county you were born in, state you were born in, and your name. And it's because that's what Pecos is requiring these days. Okay.
Now, what's Pecos?
County and state board.
County and state, yeah, Medicaid and
Medicare.
Medicare.
It's,
No.
No, I think we're all just
it's
gonna.
the,
But if you want
it's
to
the
just write it.
Medicare database for all healthcare facilities and providers. It's the electronic application for the Medicare program.
Do you need a maiden name or just married name?
The name you use right now, so.
So I question social security number.
No, I fussed about it too before I had to think of it, but I did.
I know, but the government thinks that they are privileged to everything.
The government already has it,
I'm
let's
pretty
face
sure
it.
mine's been compromised at least a couple times, with these data breaches.
Tracking, I just wanted to let you know we're tracking overtime, which our staff will be thrilled about now, because we have overtime reports and we'll be talking to them about their overtime. Okay. There is some potential change to the PPL and the EAIB, EIAB. And those changes are because of what you heard earlier. It's mainly about how much do we want to accrue for how long. 720 days seems, 720 hours is 90 days for an 8-hour person and 60 days for a 12-hour person. And that is we're better off, this is my opinion, but we're better off to do short-term and long-term disability pay instead. And that way, the employee also has the benefit of long-term disability if something happens to them that's catastrophic to them. Okay? And then credit cards, we do have the ability, and we're going to, on October 7th, I think it is, have training and do all the work that we need to for us to be able to put credit cards on my chart. So if a person has a copay, the system will automatically pick up on that, and they'll be sent a thing through my chart to say, here's your copay payment, would you like to pay it right now? And we find that there's a lot better job of upfront payment with that kind of a system, so we're gonna go ahead and go forward with that. So those are my requests. Until later.
Any questions for Kathy, or we can move on to Kim?
All right, so med staff credentialing, you've got Dr. William Shank, I think is how you say his name. He's with Dakota Radiology. Shank? Shank. So he'll just be reading radiology tests for us. And you guys can take a peek, see and executive.
Yeah.
And then moving on to med staff. Let's kind of touch on the highlights here. We've got some Benefit that's on a national shortage, so it should be in around Christmas time, but we've got Injectafer, which is for an iron infusion. It's really kind of interchangeable with what pharmacy said. So just educating the providers to order that Injectafer instead of the Benefit. Keisha gave lots of x-ray updates, so I'll kind of touch on the highlights there. Phillips is going to be here on October 8th and 9th for follow-up up in the x-ray machine. Just make sure it's going okay. The physicist was here on the 16th of August and said everything went okay with all of that. The CT scanner looks okay. wise on that. Ladies' night's gonna be held here on October 16th, is that the correct date? Yep. From 4:30 to 6:30, they're gonna offer walk-in mammograms, so hopefully we can get a lot of screening mammograms done that way.
The ones that start slow, but boy, by mid-season, you see something, and by the end of the year, they're the scary team nobody wants to play. Those are more fun than the teams that come in that you know are going to dominate, and they are dominating. You know, you're almost afraid to lose when you've got really, really good teams and high expectations.
Oh, for sure.
Those are fun seasons. Is there that potential in Dobie sports this year for some of those programs?
I think it's possible. Cody coming down into 3A this year is going to scare quite a few of us old 3Ers, but we do have that potential for growth. We are not coming in at the beginning of the season at our highest potential, which frankly, you don't want. You want your team to grow. You want your team to develop and then get to that point by the end of the season to have that shot at postseason play.
Ladies' night's gonna be held here on October 16th, is that the correct date? Yep. From 4:30 to 6:30, they're gonna offer walk-in mammograms, so hopefully we can get a lot of screening mammograms done that way. Dr. Ashley Simmons is gonna be here from Rapid City to discuss genetic testing for women. And then PACS is just gonna have some downtime. So PACS is our imaging system that they can pull the images on and read. It's going to have some downtime on the 23rd of this month until the 24th, until 4:30 and the 24th. So just be aware of that. Providers can still read the images. They'll just have to go into Keisha's little area and look at it on the new.
And it's just at night, 10:30 p.m. to 4 a.m.
Lab, they had a CLIA inspection and Jim said it went well, only one minor deficiency. It was an easy fix. Nursing home report, at the time there was a census of 39. Home health, busy. She had one nurse out at the time for sickness. Acute care, at the time we had 5 skilled swing beds, 2 intermediate swing beds with 1 going to the nursing home. That's for that. And then quality, we talked about our ED wait times and some EMS issues. Talked about the manor, what's going on at the manor, talked about the census and staffing, getting CNAs over there. Pharmacy, the old packaging machine died. So they're in there hand packaging meds for a while until the new one is up and running. So they've enlisted some help to help package all the meds one by one. So that's just kind of a temporary thing until the new one is up and running.
The new machine's motherboard was dead when
it's in now.
Dead and arrived, and now it's in.
Right. I thought early September we would have had that machine working. Was it delayed?
So it's here, but they have to do the programming of it still.
We did have a delay because the motherboard, when it came in, was fried.
Okay.
So, not a good start, but anyway. And we had a transition of staff, and so we had a little bit of getting things done.
Okay,
So
so it's
Suzanne's done a great job. Yeah.
Yeah.
So do we know when that's going to be up and running, the new packager?
I know they said it's going well.
I was originally told a November 1st go live date, like that's it, but it could change depending on how quickly they get things set up and the training on how it works.
Sure.
It could be
I think they'll be a little faster than before, so. But I don't have a date, and Suzanne would kill me if I gave you one right now, so.
Let's see, HR still working on the ADP. JT kind of touched on it a little bit. And that was about it for quality. I did ask all of the managers to submit a SMART goal to me because we need to start getting more robust quality within the hospital. Having managers look at PI projects that they need to do within their department, especially, PI projects can cut down the cost of things within their department. So really kind of getting down to the nitty gritty, see where we can fix them. Workflow issues, make staff more efficient, make processes more efficient, things like that. So more to come on that. So, but that's it for me. Any questions for me?
Okay, what did, Mary, did you have anything to add to the quality? I know Nick.
Right.
Oh, yeah.
Yeah, I think she covered most of what they talked about.
Okay, so now we're back to you, Kathy.
Well, this is a summary, just so that there's 9 contracts that we have in the folder. I really don't think you want me to read all of them to you, but they're available to you. There was 9 contracts. This is the total cost that we spent. Total cost of $392,734.
So what,
Are all those contracts,
They're in your SharePoint.
They're in your
are they
SharePoint.
done? Are they all?
They're all done. They're all done.
Okay.
This is all done. There was 2, let me roll up a little bit. There's 2 payments that we have that are posted but not paid yet. And that's it, and then they're done. They're posted.
and I noticed there were, or you, SharePoint, and I read it. There were some reversals of like $11,000 or so. That's all included in the total?
Yeah, it is. Yeah, the reverses are, yeah.
So
Only a few months, 4 months.
Yeah,
Right.
yeah, they're on here.
4 months, so
They were very, yeah.
about 100,000 a month. So can we officially announce that we're totally done with H&H?
We
at
absolutely
Weston
can.
Health Service? Okay.
Okay,
Oh,
that's.
say that loud. Everybody's gonna wanna hear
All
that.
right. So, yeah,
Hmm.
Okay, so, I've already went over the mill levy stuff a little bit with you, so I won't go over it again. Monument Health contract, that's the one that says WCH. They're all in HA. You need to go over to the folder here, instead of the requested documentation. If you just go to it. No, it was cooperating. Okay, so then go down. WCH there. Okay, so this contract is very wordy, and what it is basically a new fee schedule. And if you scroll down, but I'm not gonna read it to you, please. That would be nice. This is to continue our service as it is with Epic and Monument Health. So go down. This is how much they charge us for after hours rate for support type. That hasn't changed from the previous contract. Keep going down. Labor and licensing fees. Keep going. This is what we paid in 2021 if you go all the way down. We paid a total cost of 90. For the first, I think that's the first year, we paid $464,000 because we probably were getting everybody onboarded and everything. That sounds about what it would cost to implement it if you have somebody supporting you, helping you. And then $92,595 was in 2021. So if you keep going down further, this is the apparently this was the health services monthly support and maintenance fee schedule that we agreed to a long time ago. And if you go down to, this is going to begin in July of 25. Yeah. Yes, they keep going, all of the stuff that we have. And basically, the total cost optional contracts, that's the 3M, which is for coding, the Dragon Medical one, and Telespace. I don't have an opinion on the 3M right now because I don't know if we're using that with the coders yet or not. But up above, I guess we gotta go up one. Sorry. What I really wanted you to be able to see, I thought it was on this page. No? Go down, I guess, further than that one. I can't remember, it's been a little bit. Yeah, keep going. I thought this had total choice. It's something like, there's a number that's 300 and.
Yeah, I agree.
It's on
323,000.
page 5.
It's on page 5.
Page 5.
Yeah, there it is. The total community connect payment is $323.19,
Can you
$912.
scroll up a little bit? I
Yeah.
think there was, so there's the support service amount for $111,425.
Yes,
That looks, so I reviewed this agreement, that looks like the only place perhaps we could inquire if there was any flexibility.
we can ask them about it.
Yeah, I'm sure we need some support services. I wonder what all is, baked in. That would be a good question for Wendy.
I think that, yeah, it's a good question for Wendy. I think that they pretty much do anything we ask them to do.
Okay.
I would tell you that, and I think that it's a lot. We actually ask for a lot of support.
Right.
And so, it's the typical thing that you see. It did go down in price. It's
Sure.
going up in 25. So this is brought to you early, brought to us early, so that we know what to expect for our next fiscal year in cost. So this is something for starting July 1st
July
of
of
the following year.
So,
Is this
so it's
optional?
gonna cost $323,000 for
Right.
the year.
So because we're, I believe, affiliated with Monument, are we obligated to continue this service?
We'd have a hard time to.
The problem is, what do you do if you don't have them?
Right.
So
Right.
we aren't, I haven't talked about that yet because I'm not ready, but I put an IT folder in for you guys for next
Okay.
month. And that IT folder, there is a chance that we could change people that support us a little bit from Epic side with another company. But that's something that I'm not really totally prepared to talk about, but there's potential for it. These guys sent this to me a couple of months ago, and I didn't send it out to you guys yet because you guys getting over stickers, shocks, and things like that. But I think that we can certainly try to negotiate look at whether or not we can do something different with our support services. But I don't know, and I don't think that for the industry, they mark it up hugely, but it's very expensive for us.
I mean, I think for this year, should be.
So if I could clarify, this contract is for Epic Support Services, which is Epic. It's different from the support services that you're thinking about. This is internal Epic support that goes, there's usually not a way to carve that out of a contract, and the contract belongs to Monument. So this is separate from the support services that Wendy delivers. This is specific to Epic and just the software.
The contract that Wendy and I are working on, they do have the ability to support Epic. So that's the only thing that's different. They could support it, but they wouldn't have the platform necessarily for us. We'd have to buy the platform directly from Epic, which would probably be to our disadvantage because we probably got that special pricing going through Monument. So it's kind of one of those things where we can leave it out of the IT piece because the IT's got plenty of other things to work on, and go forward with this until and if we decide we need something different. But really, I don't have a quick solution for that, and it costs money to make switches like this. Yeah, huge money.
Yeah, the rates without that, like we did my Michigan, we would never have been able to afford Epic without that support partner. Never.
Yeah.
But I think what might be worthwhile looking at is the total relationship with Monument. So I think they do very well with us as a partner. We get some good things too, but they run the lab, they do all our esoteric tests, and they bill us at reasonable but generous fees for that. I know Keisha and I were talking, they still provide service for some x-ray equipment over across the street, and we pay them for that. So it'd be interesting to see all the things that they do on our behalf and look at the pricing overall.
Yeah, I agree with that.
And are we getting recognized for our value? Because we send them a lot, we send them a decent amount of work. So,
Yeah, we do. We send them a decent amount of work. And we're not saying we don't appreciate them, but I will say they're very, I think they're a little rich on some of their prices. That's what I would say. And I'm not necessarily talking about the IT component. I'm talking about the lab and things like that. They're not losing money on us. For sure.
we show the whole thing.
Yeah.
Okay, so are you good on Monument?
Yeah, except that I would like to get an approval of it, if we can do that later, because either if you want us to negotiate, but that's fine, but I'd like to be able to get an approval so that I can move it forward if I need to for the amount that it was for. If I can change it, I will, but down, but,
So you need the approval tonight.
yeah. You want to put that back up real quick? Unless you don't want to approve it, and then I'm gonna be scared.
Is this an annual agreement?
They sent this to me as though it was an annual, yeah.
Get somebody to do something.
Yeah, wasn't it just 21? Or did they just show? They said there was 3 years.
They sent, their first initial contract was with us for 3 years, but this one isn't this one. This is an annual, so this is showing what we paid over the whole time frame of the contract. We had guaranteed them 3 years to be on Epic. So now we're in that'll be year 5. Was that your work? Okay, so 323,912 is the amount of the approval if I can get it.
Okay, so you want a motion?
Mm-hmm.
So I move that we approve Kathy to accept the Monument Health contract for Epic for $323,912 for the next fiscal year.
I second it.
Any discussion?
The only thing, I guess that Kathy mentioned, if she negotiated down a little bit.
I'll try, sure.
Amount may change, but,
That's right. I might be able to.
and maybe not.
I'm hoping.
I think unfortunately we're going to change it.
Yes, I
Yes,
think we are.
Okay, and we started.
But we have a lot of captives with them, so we might be able to negotiate, and especially if we look at this other model, we may really be able to negotiate ourselves into a good place. So,
If it doesn't work for this, maybe another portion that we do have.
yeah. Okay.
Any other discussion? So all those in favor say aye.
Aye.
All those opposed, the same.
Green
No, Kareem made the motion.
I second.
Nathan seconded.
And did the motion carry?
Oh, the motion carried. Thank you.
What did Karen do?
Oh, we didn't hear you, Carrie.
I'm a yes.
Okay. Okay, so,
Resignation.
so did all we read Nick's resignation letter? So I understand, but I'm sad that he resigned. Right, he was a valuable member of the team. So do we need to read that, or are we good, since we've all read it, or?
Okay, I just want to make a quick comment.
Okay, go ahead.
It really did sound like he made the right choice to me. I know he had a lot of back and forth, but, he got to the point where he just knew he couldn't give this the attention it deserved. Yeah, and so I am also, it's regrettable that he's not with us, but I think his reasonings were very good. And he should be very proud of what he did on the board.
So does
You'd
that
say
mean
that we
it's-
need a motion to
Accept.
his resignation. And that's the way I think that it probably should go.
So,
Madam Chair, may I make that motion
yes, go
as
ahead.
one of the longer serving with Nick? It's with a heavy heart that I make the motion that this board accept Nick's resignation and offer him all of the thanks that all of us can imagine for all the work that he did on this board.
Yeah. Somebody second that?
I will second
All those in favor of accepting his resignation, say aye.
Aye.
All those opposed, the same. Okay, so we have accepted his resignation. So now we need to,
Yes, sir.
I was just wondering what the process, if there's anything that can be discussed of filling his position is.
That's
That's
up
okay.
next.
I don't have it in front of me, my
Oh, yeah.
printer crapped out on me today, so, okay, thank you.
yeah.
I'm okay.
Okay, okay.
So Allison, are you there? We haven't heard.
Yeah, I'm here.
Okay. Do you know what, like, I know what we did, or I have a recollection of what we did last time we had a vacancy. Can you tell us what the Wyoming statutes say we need to do?
Sure. So the guidance from the statutes is pretty vague on this topic. Because of transparency, it's usually recommended that you advertise that the opening is available and solicit interest. You can do interviews if you so choose. And then ultimately it's up to this board to choose someone who is a qualified candidate. So they have to be an elector that's qualified and not an employee or give up employment to be a board member.
Does it say how long you need to advertise for?
None of that exists in the statute.
Okay.
So it's up to this board. I would recommend at least 2 weeks just because of, the timing of how information moves, but up to you all.
It seemed like it was 2 or 3 weeks that we did last time.
Right.
2 weeks is cheaper.
Thank you. That's true. Okay.
And so how are you gonna go about advertising it, like in the paper, on the Facebook page?
Paper, Facebook page, yep.
Okay.
It seems like that's what we did last time. We advertised for 2 or 3 weeks and then we interviewed everybody that had put their, name in and we chose.
And you appointment.
Last time we did it in a public meeting and everyone who applied, we had them all come on the same day and then we conducted all of the interviews in a public forum.
Did you do it together, the individuals together or separately?
We did them all together. Didn't we, Ann?
And I remember the chairs being told.
They were all lined up here, right?
I know they would sit in HR conference room.
I think we
How you
talked,
decided.
Yeah, a panel, they were in a panel, basically of people. Well, that,
I thought they were here and talked about why they wanted to be
Yeah.
I can't remember if they were interviewed there or could ask questions later. I couldn't.
We asked questions that same night.
right, I think we asked questions. They said why they wanted to be,
And then we asked.
and then we asked questions.
You guys
And they just
interviewed
went
them.
down to each of them and answered?
But all together or individually?
I think
They
it was
were
all
all
together.
Yeah, they were all together.
was said.
I'm not, but we would have to do it all
That's what
tonight.
I just want to be the last one to answer because then I've heard everybody else before that.
That's the
Right,
unfair
yeah.
part about it.
Yeah.
I think that, you know, unfortunately, whether fair or unfair, I think that's the unfair part about it, is
Right.
that the last person that gets to answer the question
I think it'd be
has maybe a little more
more fair.
keywords.
Yeah.
Oh, really?
I bet that it was a
Could we-
different time.
The only thing that we need to do is,
So we need
whatever
to
we
decide.
ask the same one, the exact same question, the exact
To
same
every
way.
person, yeah.
Now, if there needs to be clarification in their answer, we can follow up with that.
I'm just thinking out loud. Yeah, I agree, there is some advantage element. It may be better, I mean, you don't do group job interviews, right? And it may be better to just
Do it
have a
one at a
venue where we
time.
can do it, one at a time and
10, 15 minutes at max.
Right.
Yeah.
Very short, very short.
so yeah, I think that would be an improved format.
I just,
Yeah, I agree. That's a good
So,
suggestion.
so would we want to have them all say why they want to do it together or do that separate also?
I think I would just do it separate, just like a regular job interview.
Yeah,
I just come in, just
yeah, come in one at a
tell us
time.
why you want to be on. the
What
board.
would be good is if you have the same questions for everyone.
Right,
Right.
yes.
Exactly.
Yeah.
no changes in questions.
They can come in and say what they want to
That's
say,
right.
and then we ask the same 3 or 5 questions or whatever, yeah.
That's very fair. Give everybody the same question.
What are you thinking, Carrie?
It's whatever the board pleases. I think the first step is to advertise, and then once we figure out how many candidates there are, if there's one, then there's nothing to decide.
Yeah.
If there's more than one, then we'll have more hard decisions.
Yeah.
Allison, does the law say we have to choose? Yes, we don't.
Well, ultimately, you, as a board, you have to vote to appoint an individual. That's really all the statute requires, is that you vote as a board to appoint a qualified individual. And then within 10 days of them, whether they are appointed or even after election, they have to take the oath. And then within 10 days of them, whether they are appointed or even after election, they have to take the oath before they become a true board member.
Thank you, Allison. So,
Yep.
should
My
we-
only other thought is this is different than an employment situation in that it's a public official, so the community should be very involved. It should be very open and transparent, and I mean, the board can decide if you really have to ask them the same questions. That might be a starting point, but it is a public position, so, we and the public should be allowed to ask them whatever they want.
I think you make some great points there. I will agree with you. I don't know that we have time for the public to ask questions, though. The board asks questions or however we want it, but it just.
I have an idea. In the recent election, I think it was the Republican group put on a panel. You were all there.
Town hall.
At town hall at the hotel, and there was a prepared list of questions, and it was who's the state farm?
It was Holly Morton,
Yeah,
was the moderator.
And so there was a moderator, And then there was a section for some pre-approved public questions as time allowed. What would you think about that as a format? That's what we all went through to help everybody figure out who we were and how we reacted to things. And so there were prepared questions, and then there was a time, I recall, where we each got a few questions from the crowd, and I thought that was a very nice venue.
I will agree. The only thing that I would like to see changed in that venue is not the in chair get the first question every time.
Well, they switched it both
Yeah.
times. It
Right,
would run
yeah.
one direction and
Yes.
then the other.
Well, yeah,
But it needs to switch every time.
The
Yeah.
in chair, or the in chair's got the first
Yeah.
question every time.
Yes.
It needs to be.
I know, I was the
Oh,
end.
yeah, I was too. So,
But I tell
but,
you what, Ted, we can make you in charge of answering, asking the questions.
well,
You can
you know,
switch
and
it
it's
up
hard
while you
to, somebody kind of needs to, well, you answered first last time, it's your turn to
Right,
answer
just
first
go
this time.
down, yeah.
Yeah, I think
Yeah,
that's a good idea
that
for the
is good.
moderator.
You know,
Yeah.
that's, to go ahead and to break that.
Yeah.
Yep.
And we don't necessarily have to, pay the hotel. I'm just saying, if we could duplicate that in the basement, or we could do it at the hotel, or however we want to do it, that maybe give us the best mix of some public questions, and then
And some that we
everybody
could
can
ask.
see all together how everybody reacts. And I think it should be as open to the
I agree
public.
That would be open.
But
to
I
the
think
public, yeah.
somebody brought it up, the TIM and the applicants
Right,
we have
that's
first.
right.
Okay, we're
So-
fighting a battle right now that we
So
haven't
we'll
reached
advertise
yet.
for 2 weeks, and then we'll see what we,
2-3 weeks, whatever the board chooses.
I think.
Open it up for.
All right, this is.
Do you advertise in the Weston Gazette?
Yes,
Oh,
we advertise in both.
Okay, thank you.
So Facebook and the 2 papers, is there any other, and probably on the radio.
Probably, can you put it on our website as well?
Yeah, I have that written down.
Madam Chair, I move that we advertise for 3 weeks in all forms of public notices, including posting it on the courthouse door with the other board orders.
He's like, yes. That's all right.
Do we have a second?
I'll second it.
Okay.
You get this hill, but I get the final mountain.
Okay, all those, or any more discussion?
Okay, so we're gonna post for 3 weeks and then we'll decide exactly what we're doing.
We'll see how many
Okay, yeah,
candidates.
Right,
If it is just one candidate, like someone had mentioned.
Sure.
We're picking a battle that we don't need to fight.
yes.
Trying to
So-
decide how we're gonna handle it.
When we've advertised before, we've given them a deadline.
Yes, absolutely.
And who would they apply to?
Before they came into Denise's
They came into
office.
Denise, yeah, we came in and gave
Will
them
that
Denise
be
our
on our-
everything.
will it
I think
come
that needs
see
to be
Denise
spelled out
or-
correctly. I think
something,
that you're
fill out a
correct in that.
form?
Yes.
Like the same thing that we filled out, right?
Oh,
Yep.
yeah, that's right.
Yeah.
There's a,
And then also the qualifications that they,
yeah,
that they
Because
are
that was on like
residents.
her, yeah, that was
You
on
know,
that form,
yeah.
yep.
probably, should we just use that same form?
Sure.
Yeah,
Yeah.
I mean, that's what,
Yep, okay.
Maybe not so much on the courthouse door, but the courthouse door, they have the other board openings posted on the door as you walk in, so I would suggest
put it
putting
on
that
there.
on
Yeah,
that.
that'd be
that
good.
list also.
We should.
Yeah, because I
Carrie
recall the.
got, oh, sorry.
Oh, go ahead, Carrie, thank you for noticing.
I was just going to say for logistic purposes, 3 weeks from today would be October 10th. So may I suggest the deadline maybe is October 11th, which is that Friday? And then that would give us 1 week before the next board meeting. So we could actually interview on the board meeting on the 17th if you want, or we could choose another date.
Right,
Okay.
I can't advertise till next week in the news.
And then October 10th week would be week 3.
Okay.
And you could set the deadline as October 11th, which would be after 3 full weeks of advertising.
Right,
Sounds good.
and we might as well put just a slightly sharper point on it and just say by 5 PM. Is
Yeah.
that all,
Yeah.
5 PM on that
Friday.
What time do you normally quit on Friday?
4:30.
What time am I supposed to, or what
What
time?
time are you supposed to?
Whatever you want to say.
Okay, has to be, that's.
At 4 p.m.
At 4 p.m., yeah.
Truthfully, if it gets in the email, she's not gonna look at it probably at 4 o'clock anyway. I'm gonna be
But if someone comes in, they expect normally to be
Right,
here at 4.
yeah.
That way she doesn't have to stay till 4:30.
right.
Do you want to amend your motion to make it with that exact deadline?
I amend my motion to include all that.
Okay.
Okay, are we?
You want me to do it more?
Any more discussion? Okay, so all those in favor of Ted's motion, say aye.
Aye.
All those opposed, the same. The motion is passed.
Why not 4 weeks?
Yes, you start throwing
Knock it
tomatoes. Okay, so I was gonna talk about this at the beginning. Oh, are we, so we're on to, oh no, appointment of secretary. So do we have anybody that's interested in being secretary?
I think Mary would make a wonderful secretary. She writes.
I think Ted has the most board experience of all of us.
I can't write. That's the trouble.
Can I,
So,
go ahead.
what's entailed? I mean, besides taking minutes?
Read it to her from the bylaws. Ted's got
I
it.
mean, do I type them up too?
She can type them up, Denise can.
But I just give them to you and you type them?
Well,
Yes,
so she generally takes minutes, so I think you need to just be kind of
A figurehead?
and in charge, you know what I mean, so you as secretary, more attention to, and like Nick a lot of times he would keep notes,
Yeah, so
you
you
know,
made sure
so
that
that,
there's.
so
What he
then when you
did
look at
mostly was write
Denise's,
the motion down, who first made the motion and who seconded it, and then maybe a little bit about the motion and then reviewed the minutes. I think that's not what words, but that's kind of what it looked like he had
Yeah,
done.
and
And
then,
then reviewed the minutes to make sure the names were right and
and this, that,
the
yeah.
topics were right. Or
And
topics were
I
covered.
watched the recording afterwards too, to double check. But one big thing is, noting times too.
Yes, he did do no times.
and then it's, I mean, so generally the regular meetings, Denise does it, and then in the executive sessions, generally Allison does. But Nick kind of took more responsibility, I guess, as far as making sure that it matched.
And the secretary
Is
says
second
that
in charge.
is second in charge. If Ann wasn't here, the meeting could be yours. And we can help you run a meeting if that's what you're worried about. You'll do fine with that.
I think Ted's trying to railroad you.
I haven't been on the board that long.
You're just taking minutes.
But
None of the choices.
That's probably why you got the shortest day.
That's not a good argument. That's not a good argument.
Okay, I will do it.
Okay.
And if it comes down to you're not happy with what I'm doing, then you can fire me.
Okay.
Is that a deal?
And I think all of our meetings are recorded.
Sure.
And so if we all just totally spaced out on a particular point, we can always
Go back to the recording, yeah.
Unless our recording is the first, but it's the last two.
Okay.
We're working on this. Okay. Okay, well, then.
We're all
Well,
here to
mine's
support
flawless.
each other too, so Mary will be happy to help you.
Be a board primary, secretary, ensure.
There are a lot of few
And you've got
mistakes.
help there. They're taking minutes. And Allison's taking minutes on the executive, so you do her
So
a good figurehead.
I
think she just
I
appointed.
think I just appointed,
Yeah.
so I'll appoint Mary as secretary. You got me into this.
Yeah,
Okay, Okay, so, yes, so Nathan wanted to talk about meeting dates and.
Yeah, it's his.
Okay, so quick question with whether, so what, I was gonna talk about this at the beginning of the agenda before, but or when we first talked about the agenda and I forgot, but time-wise, how long do we want? Like, I think that we should set sort of an amount of time to, well, I wasn't thinking so much about your stuff, but for the bylaw changes, because we
Right,
could get.
yes, I'm not going to
that for a
exhaust the
long
board
time.
on it. It's really just one concept and that we can discuss. And then if we can kind of agree to the concept, then we can just look at the nuts and bolts parts of that. And so I do not plan to exhaust myself or anyone here.
Do you
Yeah.
know how long Tony thinks, because he's
Yeah.
on there to
Yeah,
present as well?
Tony?
I'm here.
How much are you envisioning, how much time are you envisioning spending on the bylaws?
That's a tough question. So there were really three kind of core inputs. Kathy and JT, essentially went through and did a pretty detailed scrub. Some of it's a lot of clarification and cleanup with maybe, I don't know, Kathy, is there anything you guys really suggested that you would consider a conceptual change, or was it mostly cleanup?
Mostly cleanup, although I did want to talk a little bit about managers, directors, and things like that, and some of the process that might recommend changes for, because I just think it's,
There are some conceptual changes in your document, Kathy.
Yeah, I don't have it in front of me because I sent it to Tony and it's in my computer, but I do have some concepts that I wanted to at least visit and have you guys talk about. That's it. But some of them are for you to think about as a team.
So I guess I would suggest, in the interest of time and efficiency, perhaps Nathan discusses and presents his concept. Carrie, I think you had a few concepts maybe that you would like to introduce. Kathy, do you think you could get your and JT's copy where you can at least maybe just, we're not walking out of here tonight with updated bylaws, but I think it would be helpful if everybody would have a chance to present the concepts and then give you all time to think about those and absorb those. That sounds reasonable to me. Does that sound reasonable to you?
Yes.
Yeah.
That would be great.
Yeah, it was not my intention to make any motions tonight, sorry.
Go ahead, Carrie.
I actually had two things to start off the discussion, which may clarify and make the ensuing discussion a little easier. So one of the things that Nathan brought up, and I would like to bring up right away, I'd actually like to make a motion that the quote training tool for current and new board members that is in the board share be immediately removed before we even start the discussion of the bylaws, because it muddies the waters between the bylaws and the training documents. So I think if we just remove that from the table to start, it would make us better able to focus only on the bylaws. And the second thing is, I personally would like to completely remove the governance committee from the bylaws, which also makes discussions a little bit easier, because there's, in Kathy's and Nathan's and mine, there is conflicts between that section and other parts of the bylaws. So if the committee as a whole wanted to go ahead with those two things, I think it would make ensuing changes a little bit easier because we wouldn't have to discuss something that we were thinking of throwing in the trash can. Just throwing it out there for the board's discussion.
Okay, so I have clearly made a mistake, but I don't know how to fix it. So the question is, do we want to? So I think what we had decided is that we would deal with Nathan's things
Right.
with the meeting
Right.
dates
Right.
and the agenda process and stuff before we started the
Right.
bylaws.
See, I
Right,
have
we-
one in staff.
Oh,
I
yes.
didn't know
Yeah, we jumped
Yeah.
the agenda just a tad, but
Yeah.
it was understandable how that.
Okay,
happened.
so does everyone agree that we should do Nathan's agenda item first?
Yeah,
Okay.
I think mine are not very taxing to the mind, and so I was hoping to get those done before we get into the bylaw, aspect. Madam Chair, I move that we tentatively schedule a regular board meeting on the first Thursday of each month. Do I have a second so we can discuss this briefly?
So, does Nathan?
Sure, I'll second. Okay, then we can just.
Okay. So just in brief, I think we've agreed in concept that from a financial standpoint, it is not going to be status quo business as usual. We are going to probably be forced to undertake a dramatic transformation of how all kinds of things work in the hospital. And so I think it's very important that we would make a tentative meeting on the first Thursday of each month. If there's nothing for us to do, we don't have to show up. But rather than going a whole month in this period where we're going to have to be making lots of changes, and as John has told us, we're behind the 8 ball in terms of timing of things, I think we should, at this juncture, be more available to our executive team so that we're no more than 2 weeks away from any board meeting. And that it would be a good support.
Chases the decisions a long time.
Right, and then our board meetings aren't so long. I would prefer if we,
That's the goal.
if we have potentially 2 a month, we don't have to have the second one, but if there's things our executive team needs from us to help undergo this transformation, then I would like them to feel like they're not burdening us by asking us to come for a special meeting or something. And so, yes.
I agree with you. I think the more involvement we have, the better off we'd be. For myself, anyway. I don't want to be burdened with more meetings, but I think you've got a very valid point there. The only thing is, you said if we didn't need it, how do we let the public know that we don't have a regular board meeting?
So my second motion deals with that. It's about improving and streamlining the agenda creation process. And so my goal is if we're going to be more available and have potentially more meetings, then we'll have to create more agendas. And so we're all volunteer board members who are very busy otherwise. And so I was thinking of turning that task over to Kathy and her team so that there's one person who's a single point of contact that Allison can say, please add this to the agenda, that board members and of course Kathy's team will always have things they need to add to the agenda. And hopefully the agenda could live on SharePoint where we could all see it as it develops. But I think they will be able to predict well enough in advance for us to meet the 24-hour requirement as to whether we need to meet or not. I'm sure we'll know.
Well, I think that if you're calling a regular board meeting on the first Thursday, that is you probably have to advertise for that. What I'm saying is, if you decided you weren't having it, that you have members of the public show up and there was no board meeting.
Right.
The reverse of what you just said.
Right.
So what?
Madam Chairman,
Go ahead, Allison.
I think technically it should be a special meeting unless you are going to add it to your calendar for the year on a regular basis.
Special meeting.
And so you could schedule it as a special meeting and notify as you need it and have it so that all your calendars are free. But technically under the law, I think it needs a special meeting unless you're going to make it for the entire remainder of the year.
Because we could probably agree that mostly it would be relative to financial discussions. Not really, I'm not, unless it's an emergency like chiller, I'm not gonna run and get you for every little thing that happens during the month.
So that was gonna be my question, is whether you felt like we needed another, which Allison is saying, another regularly scheduled meeting for the board.
Well, I think if you use special meeting, that's fine too. I think that would be good. And I don't have a total concept yet of how fast we can churn things so that you guys have the piece, but at least it leaves an opening for a special meeting and everybody to have an idea of when it would be. So, I mean.
Because I personally like the one meeting a month model a lot better than, I mean, but I do get that, but that isn't what we've been doing. I mean, so we've been having more, and so,
I think we went a whole month this time without a meeting.
But we don't have to do it, but if we're needed to help let this process happen faster, our executive team shouldn't. I don't want them to feel like they're apprehensive about asking us to come in. I want to make the offer that we're willing, if you need us, to show up at that extra meeting, and don't be afraid to ask. Let's not make decisions wait all the month if they can just wait a couple of weeks. So that's sort of the thinking behind it.
Well, I'm not gonna call you to a special meeting unless I need it.
and so we'll. So maybe we just take that on advisement that if we're having a special meeting, that we aim for that first Thursday of the month.
Okay.
Is
So,
that
sounds fine to me. I just wanted to make the offer. The way it works out is.
Well, that gives me a time frame that I know I can call a meeting together and you guys know about it.
I just don't want there to be any reticence on the part of our executive team where they think, well, we really could use a meeting to clean a few things up, but we don't want to ask because they really only want to do one meeting a month. I don't want to slow them down because they need to be very fast and responsive to our situation. So if that works, that's fine with me.
I think it would help me be more informed. I think I've said that. The second thing is, I think it allows for maybe progress to be made a little quicker. You know, the issue that will come up may or may not, we'll see, but I have no problem with that.
what do you think, Mary and Corinne? Are you guys?
It's fine.
Yeah, I'm happy to do it.
A second meeting.
Sure. What do you think, Carrie?
Huh?
Get out of that.
We shift, we're done.
I share your zeal for one meeting a month, but I do recognize that we probably often need to meet more, and it is helpful if we could have a goal date for that meeting instead of having them be all over the place. So I get the point of it.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
Is helpful if we could have a goal date for that meeting instead of having them be all over the place. So I get the point of it.
So do we want a motion on that? And if so, how do we want to?
Well,
Nathan made a motion, they
Right.
would
And
have to
then,
change that.
yeah, it got a little bit confused in my mind. Are we thinking special meeting or regular?
I think special meeting gives less notice has to
Yeah.
be given.
Right. So then the motion is just to have a recurring special meeting.
Day, the first day.
First Thursday at the same 5:30.
If needed.
If needed.
And then everybody turn in their wants and needs basically to
Right.
our office.
Right, and that's the next motion is let's streamline, let's have a single point of contact. One person who manages the agenda where Allison can go to or the board can go to it. And then it's.
Oh, Carrie's.
Sorry. Yes.
Go ahead.
So I think you should vote on that motion first.
Yes, yes.
Without adding it. The second one is a second
Yes.
issue.
Yes, I agree, I digress.
We're gonna set aside the first Thursday for special
Yeah,
meeting.
so
set aside the first, yeah, that's
So
the way to put
I
it.
think I could make that motion.
Okay, go ahead and make first amended, yeah.
Thank
You're just amending your motion.
Okay, I'll amend. Okay.
Because he made the motion that we can set the
But
regular
we
meeting.
never voted on it,
Right.
so then,
But so now he can
amend
amend
it.
Okay, I'll amend my initial motion, that I move we schedule a special meeting, if needed, the first Thursday of the month.
Was there a
At
second on
5:30.
that motion?
Yeah, so Kareem needs to read.
Okay, I'll
Yeah.
second the motion.
And all those in favor, say aye.
Aye.
All those opposed? Okay. So now that day is available for.
Right. Yes.
Okay,
And
go
so
ahead.
my second, hopefully very quick motion is logically attached in sequence to that. It's a sort of a waterfall effect. Now that if we potentially have more meetings, we'll have more agendas.
Yes, we potentially will.
Yes, and so, I mean, as a board member, I'm already doing a lot. I think we probably all are. So I move that the CEO or the CEO's designee be tasked to be the common nexus point, which all agenda items are submitted, such that the CEO or the designee is responsible to field all agenda items from Allison, from each board member, and to complete the agenda, and if possible, that the agenda will be viewable on SharePoint.
SharePoint. We really did try hard this time to have lots of stuff on SharePoint.
Yeah, I love it.
And,
It's
yeah.
wonderful.
And have it
Okay.
on the boards.
I'll second that, and then we
Okay,
can,
then we can have
okay,
discussion.
I'll
So
second.
it's like here.
So Carrie, go ahead.
So the agenda is controlled and set by the board. So the admin team can do work for us, but they can't actually, the agenda has to be set by the board. And in our bylaws, it states the board chair. So I think the admin team could coordinate the information, but Ted, is that what you were raising your hand for? Am I seeing, I don't,
Yeah, can you show me that?
I guess
in
I'm
the
not being real
bylaws?
clear.
Section 5,
Okay,
under agenda.
So that's, I feel like.
Page 5.
so right. And
so
right.
the admin team can help us, but your motion is to succeed our agenda setting to the admin team, and I'm a little uncomfortable with
Well,
that.
So we're not ceding the control, was it my turn? We're just delegating the extra work onto the administrative team such that they will respond to the board in any requests we make. But we make the requests and they're simply doing the requests. They're performing the requests on our behalf in a place where we can all see the agenda. So we're more just delegating the work part of it, and we still remain in control, or the chair remains in the control of it.
So
Is that a help, or am I missing?
I think you kind of used the word set initially, but it says set by the president.
Oh, okay.
And now, the agenda may be amended by the board members. I think you've got a good idea as to go ahead and maybe give possible agenda. I'm going to put possible agenda items to one place, and then the chairman makes the choice of how she wants to approach those agenda items.
Yeah, like, to me, I feel like the agenda items should be coming to the chair.
Okay.
And then, rather than putting it more, and I mean, I don't feel like I've been doing, since Kathy and I have ceased our Monday meetings, I feel like I've kind of not been doing my job as far as helping set that to me was really useful, is having the agenda setting meetings. I don't know, what do you think, Mary?
Well, I just see if there's a lot of input, I think we need one person to cut down on the chaos.
Right.
Doesn't mean I can't tell you what I would like to see on the agenda.
Right, absolutely.
But I think we need one person to work with Kathy to get the agenda and then bring it to the board. That's just my opinion.
And that's the board chair's role, as they're supposed to be the liaison. So I see what you're trying to do, Nathan, but I think in your idea of making things more streamlined, it actually makes things a little less streamlined, because when you say it goes to the admin team, there's more than one person there, where if it goes to the chair, there's only one person, there's always only one person. And it's the person who sets the agenda and decides if the agenda item goes on the agenda. That's the chair's decision. So if you send it to Kathy or her team, she might say, oh, okay, that's gonna go on the agenda, but then Ann might decide it's not gonna go on the agenda. So I think it creates a level of confusion.
Okay, sure, that's fine. I was just trying not to overwhelm any of our volunteer board members with extra work, but that's fine. I'm happy with that outcome.
I appreciate what you're trying to do.
Madam Chair? Yes. In the past, the president has met with the CEO the Friday before the board meeting to go over what would be on the agenda.
So was there a motion there, Nathan? To do
I'm just suspending that motion.
You have to withdraw. Yeah.
Okay, I'll withdraw the motion.
And I do want to say that, like, I want the members of our board, if you have something that you want on the agenda, I would appreciate and welcome being told that. But I do think that is, like, I agree, I think it's the job of the president or the chair.
I'm not trying to step up.
So do you meet at all with Kathy before the meeting?
I haven't since
A while back.
Oh, yeah.
Okay.
But I would like to, I would like the board to give me the freedom to do that again, to meet, for Kathy and I to have a set meeting time to set the agenda.
Is there anything in the Bible that says that you need permission for that?
No, there isn't. I don't think there's anything in the Bible that says that.
I
think it would be just like meeting with one of us to go ahead and talk about an agenda item, whether it be on the phone or in person.
Yeah, there's no, I think any board member can meet with Kathy at any point. That's perfectly fine.
Speaking, Curtis is chairman of the school board, and before the meeting, every month, he meets with the superintendent, and they discuss the agenda.
Yeah.
So,
And
Well,
that's,
there's gonna be things that Kathy wants on the agenda, whether
Yeah.
it be you guys or staff,
Right.
things that have come up.
and hopefully things that the board members want on the
Yes.
agenda. And so I just think that the logical way to do it is for the board members to come to me if they want something on the agenda, and for the administration to come to Kathy and for things they want on the agenda, and we work it out together. Isn't that what you would say? Okay. So, is that, are we good with that then? Okay, so, and you had one more thing, Jeremy.
Right. So if we perhaps will have more board meetings, I've kept track. So we've had, Allison has given us 3 minutes of legal advice this whole meeting. I've kept track here. And right now, our legal bill for this meeting is $585 for 3 minutes of advice. And so if John, I hope John impressed upon us all the seriousness of our declining financial situation. And so I very much appreciate Allison's input. It was wonderful. But I'm constantly looking for any options where we can free up some money to pay someone's paycheck, to pay someone's benefits, because we're having to look at cutting people's benefits. And so this is really the board's single expenditure, is on having Allison being a regular member. It was very wise before we got to that point, because we constantly needed that advice. But I expect our meetings to be more in this format going forward. And so I'm giving a little information before I make that motion. I probably should have done it after the motion, sorry. I just want us to consider if we think this is a good use of our funds as we are reaching at almost financial crisis standpoint. So sorry, I should have made a motion there. I did it all backwards. I'll start over. I move that effective for the next board meeting, for cost-cutting reasons, that Allison no longer be a regular attendee of our meetings.
The regular meeting too?
Well, right.
Of regular meetings, he said.
Right. Not that, that she no longer be a regular attendee, just coming to every meeting and the legal tab running. That's my point. If we need her, she can be here. But, I think we're going to get to a point where we can navigate through a meeting without Allison charging us $250 an hour. Yeah.
Go ahead, Carrie.
Nathan, I respectfully disagree with you on what you just said, because Allison is the legal counsel of this board and we need her. I can't even remember a meeting where we haven't asked her a question. And there's no way that she could, I understand what you're saying, and when you look at it, just like what you said, that she only gave 3 minutes of legal advice, but that's overly simplified, because she needs the context of the whole discussion in order to give us good advice. And she's constantly listening while we're doing things. I mean, I can't see her, but I'm guessing that she's researching when we say things, and she speaks up when we're about to do something incorrectly. And I think her advice and her presence in meetings is invaluable in keeping us on the right track. And if we only ask for her when we think that we need her, I think we're gonna head down paths that we shouldn't be on, that if she was there, she would tell us not to head down.
Yeah, thank you for your
She-
input. Did I get a second to the motion? Should we do
Did
that
you-
first?
Did you make a motion?
Yeah, I did, sorry, if no one heard it, I'll do it. Yeah.
Okay, so no, Nathan is right, we do need a second. So
Was there a second?
Sure, I'll
Oh,
second.
okay,
I'll
all right,
second.
so Carrie, we'll just pretend like you said that after.
Thank you, Nathan. Sorry I missed the second,
Okay.
or the lack thereof.
Okay, is there any more? Go ahead, Ted.
I served on very few boards that legal advice wasn't present at all the meetings. I agree with Carrie, and the context of what was being talked about is very important. And we have not had a meeting that we have not gone into executive session. Our legal counsel keeps our executive session minutes, and she also makes sure that we follow the law going into executive session and coming out of executive session. Day and age, I agree cost is very appropriate. But I also, I worry about treading the wrong way sometimes about legal advice.
Well, I worry about the cost. If we do something that's not right or legal, it's gonna be more than $500 or $585 to rectify a mistake. So I'd rather be on the safe side and have legal counsel available.
I have a question, actually. Maybe it's for Allison, I guess. Do you attend like full board meetings for other boards, or I'm just curious what's normal, because I really don't even know what's like normal.
Yeah, so we attend the full board meeting for Campbell County Health, for St. John's out of Jackson, and I'm also doing it for Weston County School District number 1 and Campbell County School District number 1.
And so it is normal and customary that you just, I mean, that's just part of when you have a board, you have a legal advisor that basically is, attending the meetings.
Yes,
Yeah.
for all of the boards that I'm familiar with that have employees and businesses the size and scale that you all do, yes.
Right, so Allison, can I ask a quick question, just critical thinking? Have any of those entities that you're speaking of, have they lost $1 million in the last 2 months? Because that's our situation.
Yeah, if you haven't read the newspaper on Campbell County Health, there are multiples of that on occasion.
Okay. So that was just my thought. If we're going to have more meetings, do we want to have the extra legal cost? Sounds like everybody does. So
I mean, just for this board's sake, I'm perfectly happy to not attend a special meeting on financial matters if that's what the CEO and board chair desire. Maybe that's helpful.
right. Yeah, I'm very happy to have you, and we need you, but I'm just looking for anything we can do to try to improve our financial situation. And I certainly don't want to cut people's paychecks or their benefits or anything like that. So I'm just looking for anything we could possibly do to help that out. So I guess, is it time to vote? I don't know for the question.
So all those in favor of Nathan's motion, say aye. All those opposed, same. None.
Nay.
Okay, so that motion failed. Probably what Kathy and I should think about is like, if we do have a special meeting, just kind of talk about and consider whether we need to invite Allison. Does that sound fair enough?
Sure, and really the first two wonderful inputs on Allison were about the election thing. And I can't remember what the third one was. And so if we can maybe have her at the beginning of the meeting, or if we could schedule Allison for the end of the meeting, and then if, I'm just looking for our situation is really not good. And so,
No.
Carrie?
I have a suggestion. What if the meeting that we're adding, we try to formulate it more as a work session rather than a full-on board meeting? Because a work session, you perhaps wouldn't need your legal counsel there. Would that
Well, but if a
the
quorum
good solution?
if a quorum of the board is present, then it has to comply to all the standard rules for notice before the meeting, et cetera, et cetera. So if we have a work session and a
It
quorum
still
is
is a meeting.
present, then it just has to be a meeting. Right?
Yes, but no decisions can be made in a work session.
Right, and we.
Correct.
No
Yeah,
motions.
correct.
And we.
Which therefore you may not need your legal counsel there if you're just planning on working and discussing and
Well, right.
not making actual, we save all the motions for the regular board meeting.
Well, right, but the whole purpose of adding the special meeting, which we did approve the motion, was to be able to make decisions in a more timely fashion, more often than once a month. And so if we meet as a work session and don't make any choices and kick them to the next board meeting, then we've
Still less
accomplished stuff.
flexibility, yeah.
And,
I think it was a fair point.
okay, great. Thank you, everybody.
Okay, so now, are you ready, Tony, to work on the bylaw changes? Oh, wait, 1 minute. Ted has something to say as far as bylaws thoughts, I think.
No, I was
Oh, no.
going to ask for a person.
A timeout,
No.
bathroom break. Oh, I had to take one already, I'm like, okay.
You
So
know, I
the
was
only-
trying to wait for executive session, but I can see we're gonna be another hour.
So let's try to aim for the bylaws, but maybe not.
I
Yeah.
think it'll work, I think you can make it work.
Okay.
Because you're
So,
not gonna make a final decision.
Right,
If
if
we
we're
do a final
gonna
decision,
discuss
we would die.
concepts, if
Right.
everybody does 10 minutes on their concept, that's
we got
half
a
an
chiller.
hour.
Yeah, well, we got,
Yeah.
and then we got a
I don't
chiller.
have a concept, I have comments.
Okay, comments, that's whatever we need. So, another thing, I think we should, okay, let's take our bathroom break, we will come back and,
I call for
hopefully-
personal privilege.
oh,
That's what
sorry,
I'm-
hopefully we will be back for less than 5 minutes.
Yes.
There's lots of bathrooms in this building, so just saying.
Recording stopped.
Who needs a bathroom?
Okay, so Tony, oh, Ted,
Madam Chair, before we just start this discussion.
Recording in progress.
Madam Chair, before we start this discussion, I really think that we need to do bylaws and discuss bylaws. But what really bothers me is that we have not had a board training to know what our duties ought to be. And here we are discussing changes to bylaws when we don't even know what our duties are. And so I would stress that these thoughts on bylaws be presented, not necessarily tonight, but kept so they can be presented later. And us have some kind of board training, whether it be 2 evenings, 2 afternoons, something or other, whatever it takes, so that as a board member or as a chairman or as a secretary, know what our duties are before we start changing rules
I think that's good.
to fit that or not to fit that. That's my suggestion.
Do we have other thoughts? Go ahead, Sharon.
You're muted, Carrie.
You're muted.
Sorry about that. I just said that's an excellent thought, Ted.
I feel like, oh, go ahead. Does anybody else, before I say what I think? I think that we've got good input that we should talk about tonight. You know, like the way Tony was talking, but Ted was mentioning that to me earlier, and I just think that there's a lot of validity to it, that before we go voting and making wholesale changes, we really should have some, I would just appreciate more board training to some degree before we go too far forward with the bylaws.
Tony, do you have something to offer to that conversation?
Yeah, I understand that suggestion, Ted. I think it's a good one. Would you guys, kind of back to Nathan's idea of could we actually get a meeting scheduled maybe 2 weeks out where we focus on board training? Would that be amenable to everybody?
Yeah, sure.
I have no problem with that if we can find somebody to give us that training and that notice.
That's Tony.
Oh, okay. All right.
That's what Tony and I have talked about it multiple times, but we just keep
But-
going, oh, we gotta get this done, we gotta get this done.
So would that be the first week in October?
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
Tony and I have talked about it multiple times, but we just keep
But-
going, oh, we gotta get this done, we gotta get this done.
So would that be the first week in October?
Go ahead, Corinne.
The first week out, I'm on a cruise ship in the Caribbean, and I am not coming back for a board training, so.
Yes, you are.
No, I'm not.
You can miss.
That week is out for me, just saying.
You don't have to pack your baby. You just stay here.
It might,
Yeah.
if you're gonna be electing a new board member as well.
Yeah, it might be wise.
It might be wise too.
Oh,
That's also a good
that's a
point.
good
That's
thought.
a very good
Yeah,
thought.
that's a good
Yeah.
one. Carrie, can you?
Madam Chair?
Are you? oh,
It
sorry,
might be
Allison,
busy to do what?
Go ahead, Allison.
But you're fine. Sorry, I don't know when to interject. There are a lot of legal issues that are included in the proposed amendments, and I don't know how best to address those with the board.
Right. So I was planning on just presenting one idea tonight. And so, but Carrie, are you still with us? Can you hear me?
Yes.
Yeah, I totally agree with what you said about this training tool thing. And I even question whether us as a board should recognize that a document approved by a governance committee, which was a committee not of a quorum, it was less than 4 people, why that should even have any authority on us as a board. But yeah, I totally agree with where you're going with that document. I like what you said there. But yeah, we can talk about that in a minute.
I'd be happy to make it as a formal motion.
Yeah, I would be happy to second it. I guess it's practice.
Okay, let's, okay, go ahead.
But I guess it's just a term of who wants to go first.
Well, no, so the plan is that Tony is running this part of the meeting. So we need to what, so we'll just,
Did Ted make any motion to make any change?
I did not make any motion to change. I just suggested a board training before we make changes.
I'm a little confused because I did prepare a single motion for our consideration tonight.
And I'm asking not to address that tonight, to leave that board training.
You mean the board responsibilities thing included in that?
Yes, I want board training before. That's what I'm asking, is that we address this after training so we know what our duties are.
So that would be a motion.
I could make that into a motion, but
so would that include not even talking about any of the stuff?
I have no problem talking about ideas.
Okay.
Just not making decisions before.
Right.
I have no problem talking about ideas.
Well, could you
Go
read
ahead,
it?
Corinne.
I think Tony
Let's
had
wait and
something he
hear the
was starting to
idea.
say about this, maybe
Okay.
about like the order or something.
Okay, Tony, thank you.
Did I hear, I think there was something kind of trending in the room that possibly, so on the timing of training, was somebody going to suggest waiting until the new board member was appointed before said training is done? Did I hear that correctly?
Nathan made that.
Yeah.
I may come up with that.
Actually, JT thought of that.
Yeah.
That's probably good advice. Go ahead, Tony, keep going.
Yeah, so it's really, tonight, you guys can decide the value. If there's value to Carrie and Nathan and Kathy / JT, presenting, discussing their concepts just for better absorption by the board, that is totally fine. My ask of you guys is, I guess, just to think through the timing and let's get the training on a calendar and start working towards that. So I think that's a fabulous idea, Ted. I do think it'd be good to do that before any bylaws are finalized. So that's a good process. So it's really up to you guys to decide tonight. Do you want to take 5 or 10 minutes per person and talk about the essence of your proposal, or do you want to table that to a future meeting?
I'd like to proceed as planned if everybody was okay with this.
So what do you mean as proceed as planned?
Well, I prepared a document, and it probably won't take me even 10 minutes for us all to look at it.
I think the first measure would be to deal with Ted's motion for the training to set that.
Well, so do we want to set a date for training? If we've got 3 weeks, possibly 4 weeks before a decision is being made on a board member.
Is that gonna actually end up being 2 months then?
Yeah.
It's gonna end up being at least 6 weeks minimum.
So can I say, my motions have a time value in that we're approaching the mill levy vote. And my motions are in response to community input on how they would like to see our bylaws changed. And that the reason I prepared them and wanted to speak about them tonight was that we would have sufficient time to consider them before the mill levy, and if we all thought it was appropriate, we can even consider acting on one or a few of them as a sign to the community that we hear their input, and if we agree with it, that we'll give them a sign of goodwill that we hear their voice and we're here to honor their reasonable input on how their hospital should function.
You would need to either table a decision for education until after, because that is an item that you brought up now.
I did bring it up, but I did not make a motion.
So they're okay to move on with that.
As far as parliamentary procedure, I think because there is not a motion on the table, it's up to the chairperson to, if she wants to move on to another subject, or Tony, if Tony is running the meeting. So but I think we need to set a date, possibly.
So so my 2 cents are, I think your point is valuable. I think there is value in discussing the 3 different, but I agree with the 3 different, what the people that brought stuff, I think we should discuss it. But I also agree, I don't think we should vote on these things until we've had some training. That's what I think.
The only exception to that would be this training tool created by the prior governance committee.
Right.
I don't even think it has any bearing on what we do. Right. And I don't think we need to think about that. And I agree with Carrie that if she was willing to make the motion, I would be happy to second that. But yes, with respect to everything else, I agree we should approach this with caution and lots of forethought. So we might as well just get started.
Okay, so let me do some ordering here. So not ordering as embossing, but, so Ted, why don't you make a motion about how, about training before changing our
Okay.
bylaws. And Carrie, why don't you, so we'll do that first, then Carrie will take your training document issue, and then and then Nathan, Carrie, and Kathy will do a brief, hopefully 10 minutes on each, what their concepts are. Does that sound like a good plan with everybody?
Sounds great. Madam Chair, I think it's important to some people like Nathan, I know it is for him to talk, because mine has got a lot of clarifying points on it, or some things relative to order, and I'm a little bit concerned that if I bring it out now and then it's 2 months later, are you guys gonna have any appreciate, you won't have remembered it, so that,
So
to me,
you
I'm.
would rather wait? Okay, that's fine.
Yeah.
That's, I understand what you're saying.
Yeah.
So that should be my question for you too, Carrie.
Let's go get a look.
I'm back.
Sorry. Kathy was just saying she would rather, Kathy was saying she would rather not talk necessarily about her changes if we're not really gonna do any voting until for a couple of months. Do you feel the same way?
I'm fine with that. I'm fine with that. You know, the only thing I would say would be to explain to you the issues that I saw that I was trying to correct so that they can be kept in the back of your mind. However, that can be tabled as well. It's up to the board's pleasure.
We will let you tell us what you're thinking. So, but so I'll call on you when I'm ready. Does that sound all right? Okay.
Fair enough.
Madam Chair, I move that we have an official board training as soon as reasonably possible after the new board member is chosen and seated. And that I hate to make it part of a motion, I'm not going to make it part of my motion when to have it, because we don't know for sure. But that's my motion.
Okay. Do you have a second? Do we have a second?
Sure, I'll second. All those in favor say aye.
Aye.
All those opposed, the same. Okay, that motion is passed. So now we're ready. Okay, so Nathan, do you want to just carry? So Nathan, what do you want to make a motion to?
I'm back. Sorry about that. I haven't seen my brother-in-law in 3 months. I did at least a kiss.
Do you want to talk about the training document right now?
Sure. The reason why I am asking this board to disregard it is, as Nathan said before, it muddies the waters, and there's inconsistencies in it, and there's conflicts that it gives the board, the executive committee, the chair, the treasurer, and the secretary powers in that document that are not given to them in the bylaws, and it muddies the waters. And I think our bylaws should be our rules, and we shouldn't have any other documents that conflict with our bylaws and create any kind of, it makes it very confusing for a new board member to read the bylaws and then look at a document like that and say which one is correct, and they shouldn't have to decide which one is correct. They should only have the bylaws and that's the rules.
I've read this document several times, Carrie. I thoroughly agree in your analysis of it. I think you're totally correct. And I don't think that, an act of a committee, which was not a vote of the prior board, should really even have any authority over us. And I think you're right to point that out.
I have no say, but I would agree. That's not our document.
I would too, but a question, did the prior board accept this document at some point in time?
The governance committee formed it and
The prior board did vote they voted to include it in the SharePoint for future boards to evaluate.
Okay.
But the prior board did vote to put it in the SharePoint.
To kind of accept this.
So
Not as part of the
Now,
bylaws, but on top of the bylaws.
You all could have policies that have to do with orientation and that, but make them what
they
you want.
accepted it the prior board accepted it as a training document with the full understanding that the new board could either use it or discard it. And I'm asking you to discard it.
I recollect that I think you were asking that at the meeting before we were elected, but. Yeah.
Carrie, I guess.
That's correct,
my
Green.
fault.
I've been against it from the start.
Yeah.
My fault, nobody else's fault. I have not read that document. So I would like a chance to read that document, but if it contradicts anything that we want, I agree that
It's a mess.
if it's a mess or messes up the waters,
It definitely
muddies
does.
the water. Yeah, that's the right word. Not messes up, muddies the waters. I would agree with you.
Well, so can I show you one thing?
Sure.
Just to demonstrate. So the bylaws that we have a liaison concept for the chair.
Mm-hmm.
And it's limited to liaison to the administrator, CEO, and liaison to the legal counsel.
Mm-hmm.
So this extends that. It says that the chair becomes the primary liaison for other executives, media, stakeholder groups in the community.
Okay.
So this is giving the chair more than what the bylaws ever do. And I agree with Carrie that if we're going to embark on a appropriately long process of looking at our bylaws, that we can only truly focus on the bylaws as the document which we're trying to amend without creating contradictions. If we let this document continue to exist, then we have to not only look at the bylaws, but we have to compare it to this document, which I don't recognize this document as having any authority over us inherently. And so I'm more approaching it from the standpoint that it says governance committee,
Okay.
which is one of our standing committees. So we have finance quality joint commission. So I'm more of approaching it from the standpoint of the prior governance committee, which was a group of 3 board members, cannot bind us as a board with this document. And so I'm thinking of just disregarding it because of that, without consideration.
I don't think you even have to vote on it because it's not really
I think it would be all right to go ahead and have Carrie make the motion and us just say that we're not gonna use that
What would
document.
happen though?
haven't read it yet.
What would happen though if the board chose to put that language in the bylaws? When we revisit bylaws, not saying that language, but maybe other language in there.
The problem is having 2 documents.
Well, I agree with you, I agree with what you're
And
saying,
so,
but are you saying that the board couldn't choose to put that language
of
in the
course, the
bylaws?
board could if it wants
Okay.
to. I'm just approaching it from the standpoint that the prior governance committee, I'm saying they have no authority over us, and their decision to adopt this document is not binding on us. I don't recognize the
Somewhat disagree with you if it became before the board and the board voted on it.
They didn't vote to
To
necessarily.
include it in the current bylaws, but an
Right.
attachment to the bylaw. And I agree, it
No.
totally mutters the water.
No. Go ahead, Carrie.
They voted to put it in the SharePoint as a training document for future boards.
Okay. My misunderstanding.
But to your point, Ted, I do understand what your point is in that if this board decides to give the officers the powers in that document, then you could use that document to change the bylaws. That's what you're saying?
Sure, not
That's
whether
why you
they,
wanted-
I'm not saying one way or another, but whether it's that issue or another issue in there that may be a good idea that we want to include in our bylaws, but not to exclude some of those ideas. And I haven't read it, so I don't know.
Fair enough.
Gary, did you want to make a motion?
The only,
So I had expressed an intention to make a motion, but Ted had asked that he be allowed the courtesy of reading that document before I made that motion. Am I phrasing your words correctly, Ted?
Yes.
Would you rather I held off on the motion?
I would rather you hold off on that motion in the effect that we have not had training. That's probably more my.
Well, and I have a question. My question is, does that document have any authority as it stands? Yes or no?
I don't think so.
So if it doesn't, then reading it is fine. You can certainly read it as many times as you like. But can we agree that that document has no authority as it stands? Or not?
And to further your point, Nathan, my reasoning for asking for thinking about making this motion today was because I don't want that document used in training, because I think it will confuse new board members. I would rather have trainings done with new board members without it.
Right,
Yeah.
right, but
Is that a fair statement?
Right, but yes, I thank you for bearing with me. I don't want to wear the board out, but my view is that document has no authority as it stands. And if we can all agree with that, I would be happy to make a motion where we just declare that we all agree that document has no authority as it stands.
I think that's pretty close to what Carrie was gonna make, or what,
Right.
is that what you were?
My motion was gonna be to remove it from the board training SharePoint.
Right, so I think the removal could be a separate decision from our declaration about our opinion of that document. That's kind of where I'm honed in on.
So the problem that I see, which, and Nathan, I'm in complete agreement with you. I do not think that we're under its authority. I don't want to be under its authority. If we could, I mean, I agree with you. But what the problem that I do see is I don't think either Mary or Ted have read it. Is that right?
Correct.
And so I don't want to ask them to vote on something they haven't read. I
Well-
mean, I've made that mistake already.
I was gonna say, in the past, that has been a big deal, having something that wasn't available to read, and I realized it was available.
But you didn't know
I
what you
haven't
should.
read it.
Yeah.
Not that it's gonna change my mind, but
It's,
I
have no problem with holding off on the motion to the next meeting and giving y'all a chance to look at it and decide if you think that it should remain for future boards.
okay.
I think that's fair, thank you.
And where could Mary and Ted
It's on
obtain
the-
a copy?
I believe it's under in the SharePoint.
Well, it's supposedly in
under the
SharePoint,
governance.
but
Yeah.
as these changes come about, I
Would it-
personally would really like to have a hard copy with language that you don't want in the thing struck, not struck out, but a line through it, but struck.
Track changes.
like this. I mean, so here's
And what would like to consider.
Looks like.
But I'd like it in a printed form, so I've got time
The
to.
red language is the proposed proposed change.
Would it also be helpful, because Allison is on the line, to see if she has any background with this document?
Yeah.
Just to make sure that it is in order, what you guys are proposing?
Because she has reviewed this document.
I could also print it for you.
I mean, that would, I would ask her if she.
I did not prepare this document.
Oh, okay.
And I was not involved with drafting it.
No, I would look a
I
little more
think it's-
professional if you had.
I think it is helpful to have some type of training tool. My law firm has legal training we do.
That's what
I think that you're gonna get some guidance on
That's,
board duties.
Sorry.
And Ted, to your first question, this is housed under the board orientation folder on SharePoint.
Board orientation.
So they would be in order to, there's no restriction from any other meetings, they would be in order to.
This is not binding on the board in any way.
Perfect, that's what I was making sure.
There's your answer right
So this
there.
is just really a suggestion. And it doesn't need to be like struck out.
Just so that we can see what we're taking out and putting in.
Yeah.
Without going back to the screen. 10,000 times. Because part of this, what I'm worried about in changes, that we need to take it slow and easy, but in maybe one section at a time.
right.
But to make sure that changing a line in this page, number one, doesn't affect something back here on page 23.
I did all of that work for my motion, so I read the bylaws several times. And I spent lots of hours to try to make it.
But it doesn't make it
can
nutty at the
visually
end.
See the change.
Yeah.
And then I added in there everywhere else that change would have to flow through, so we don't have any contradictions.
That's why I would love to have a printed
Yeah.
copy,
Yeah.
struck copy.
I think Allison kind of helped with this document. It really has no binding, it doesn't have any.
She didn't help with it.
No, she let us know that the
No.
document has no binding.
Yeah.
It is-
No,
it-
she said it's not
it has
binding
no
to the board in
authority
any way,
to
is
the
what she
board.
just said.
So it could be disposed of without, any major concerns. But I think that there was a call to wait for, Ted to read it.
Well, if we're going to dispose of it, I would like to read it.
Right.
There may be a good idea in there or two, maybe not.
And it could not be disposed of.
Sure.
But
not
knowing that it
included
has
in the
no
board
authority.
training.
Well, right, I think Allison just told us, as it sits, there's no authority.
I know, but not include that in any kind of
Right,
board
but
training,
yeah,
because it does muddy the
please,
waters from
please.
what this has said. That
So
is-
then you could
read
just
it.
say removing it from training.
Yeah.
Right, yeah, just please read it all
Yeah.
that you want, okay.
The ones that start slow, but boy, by midseason, you see something, and by the end of the year, they're the scary team nobody wants to play. Those are more fun than the teams that come in that are going to dominate, and they are dominating. You're almost afraid to lose when you've got really, really good teams and high expectations.
Oh, for sure.
Those are fun seasons. Is there that potential in Dobie sports this year for some of those programs?
I think it's possible. Cody coming down into 3A this year is going to scare quite a few of us old 3A'ers, but we do have that potential for growth. We are not coming in at the beginning of the season at our highest potential, which frankly, you don't want. You want your team to grow. You want your team to develop and then get to that point by the end of the season to have that shot at postseason play.
As it sits, there's no authority.
I know, but not include that in any kind of
Right,
board
but
training,
yeah,
because it does muddy the
please,
waters from
please.
what this has said. That
So
is-
then you could
read
just
it.
say removing it from training.
Yeah.
Right, yeah, just please read it all that
Yeah.
you want, okay.
Okay, so,
Madam
Tony-
Chair, can I make another suggestion?
Yes, you can.
I have all three proposed change documents. I'm happy to integrate them into one kind of track change document that would reflect Nathan and Carrie and Kathy and JT's input, and get that out to you all so you can kind of begin the thought process and the review, so you can in an integrated fashion see those changes. And I think that would be probably a better way for you guys to try to absorb the totality of what's being proposed. So I think as it relates to changes, let me just suggest that as hopefully a helpful next step that we could, I'm happy to take care of that. It won't take long, and then we can move forward.
Yeah, Tony, I totally agree with that. The number one thing is we have to have version control. There needs to be a single document where if we make a change, it's updated there. So if we have 3 or 4 different documents, that of course will be a rat's nest of difficulty and problems. So I totally applaud that suggestion.
Then you can just merge them, then you can review them.
Merge them, vote on
Accept,
them,
decline, and then you have
Right.
a final.
And the reason I submitted a PDF is just so that we don't get into that version problem. And that if the changes are accepted at some point in the future, then we have a hard copy to say, okay, it should read this. And
We'll
then
change the
doesn't.
heading, the official
Right.
1924.
And then I can put the copy in your hands.
Yeah.
Where you can say, okay, this section is supposed to be like this, and we can look at the new versions, I guess it is. And yes, so I.
Throw the old document away and move to the new one.
Yeah.
I agree.
So Tony,
So I have the Word document, and it looks like what was prepared by Kathy was a conversion of PDF.
Yes.
I'm happy to share the actual Word document so that there aren't weird typos that are created. Additionally, I don't know how you want me to advise you on the things that you're proposing that are not legal.
Well, those are important.
we definitely want your advice. We want you to tell us.
How would you like me to do that, though?
Would it be best for you also with Tony to review that, Allison, so that if there would definitely be no need of extra conversations if things are not legal, and we'd like to know.
Yeah, I'm happy to make comments, but usually it's a little more complex than a 5-word comment in the document, so.
This isn't answering your question, Allison. It's just throwing more stuff in. When we go through these, I really want to go through it paragraph by paragraph with the whole board. Not just like what I'm hearing, which I'm probably just not understanding it right, but that sounds very overwhelming to me, having 3 different people's changes on the same document.
That's why Tony's gonna put it all into one, I think, is what he's proposing.
But she's saying that it would have everybody's stuff in the same.
Right. I like what Ann is saying because I'm tracking with what you're saying. Is if Tony could do his project, then he could incorporate all of the proposed changes into the bylaws, and I would appreciate going through from page 1 and start at page 1, paragraph 1, and see how that change would affect things. And then it would be ultimately, I guess, Tony's responsibility to make sure if that was changed, everything else that would need to be changed was incorporated in that change, which I did in my document. And then we could just start line 1, sentence 1, and we could see all of those changes from page 1 through. I think that would be a very helpful visual aid.
And necessary for Allison to make sure.
Right.
Yeah, I would suggest we do this in a workshop where I can help advise as we go.
That's what I
It's usual that the attorney is the one who is drafting and editing the bylaws at the direction of the board.
Yeah, I feel like we should go through it in a workshop setting where we're all here and we're just working through it. And that would include you, Allison, and Tony, and we would just work through it but it needs to happen, that workshop setting needs to happen after we've done our training, some board training on what our roles and responsibilities are.
I think that it could be prepared and reviewed. Ted did not actually include in his motion that no action could be done without the training. He just recommended the training or made that motion. So technically, you guys could still be in the process. Get Tony and get Allison, have a workshop, and see where you guys land. Because it's important to get Nathan's perspective. He's reviewed, he's come up with some ideas to understand his. The same with Carrie, and I know that Kathy and I sat together, but ours were just really housekeeping items because there were things in there that needed a little bit more clarification. But again, I'm not from Wyoming, and that would be Allison to say, making sure that we're in line with the law, because that is more, that's the number one trump, is that we have to be in line with the law beyond what we think should be done.
So Tony, where do you want to go with this? Are you still with the idea of combining them?
Yeah, I mean, I think the fundamental process is get them combined. I don't have any particular religion on who owns that document. If it makes more sense for the attorney to do it, that's 100% fine. I'm just trying to support and get you guys moving forward. So I think we have agreement on integrating things into one version. I think it'd be great if Allison would flag things that needed legal discussion in the workshop, and then we come together in the workshop. So I think the core process is there. Hopefully everybody's on board with that.
But in a workshop,
Well,
we
and
can't make
Tony,
choices.
just to be clear, I'm okay with you compiling the edits. That's fine. I'll just get you the original Word document, so you're doing it on the actual bylaw draft.
The workshop would get you guys to a point.
Yeah, that would
But
be good.
we couldn't make any
Allison.
decision.
But you could get it ready and then approve it in your next.
Right, and then we
And
would.
Tony, I can sit, so what I did is exactly what Ian asked, or was thinking, and I was thinking. So I just went through the bylaws and started chronologically. And if you would like, I can send you my Word document that has changes, beyond this, and maybe that could be a useful tool for you. So let me know if you'd like to see it.
Okay,
I would, thank you, Nathan.
okay, so so everybody correct me if I'm wrong, but what I feel like what we need to do is we need to get our new board member, we need to schedule a training, we need to schedule a workshop. I would prefer if the workshop was after the training. Does anybody else have preferences on that? And just in 2 minutes after we have somewhat agreement on that, then I'm gonna ask both Carrie and Nathan to give as quick a synopsis as they can on the things they're wanting to change. So is
If you want,
are we
I have
okay?
no problem with that scheduling.
Yeah, okay, so, Carrie, quickly give the things that you want, just to, hopefully a 2-minute description of what the things that you want to be thinking
Okay,
about.
so I'll just tell you the problems I was seeking to solve, and then you all can decide if that's the right way to solve it. First of all, the election date. After the election, there's a gap before the next board meeting where it's unclear who's really the board members and who's the chair. So I was seeking to clear up that gap between the election and the next board meeting and who was the chair at the time. The second problem was the language under the administrator's approval of positions. I think we need to have a discussion on that and solve that issue. Again, the language I put in like 3 other places is basically to solve the election problem and who's the chair in between the election day and the next board meeting. So basically for the month of October and November.
No, actually, Carrie, it's May. I know
May,
that when I read
May, the month of May, sorry. The nominating and governance committee, I'm suggesting that we remove that as a standing committee from the bylaws, because ever since it's been added, it's been nothing but heartache and headache. So we should really think about if we really want that in our bylaws. And then the other issue I was seeking to solve was the chair appoints the secretary and the treasurer, and the chair appoints the committee members. And I think that if the chair wishes to remove a member from a committee, that it should be the board's decision, not the chair's decision. Just to protect every member of every committee from having a chair just unilaterally removing them from a committee. I think it should be the board that has to decide that. And those were basically the crux of the issues that I was seeking to solve with the language that I changed in the bylaws. 2 minutes?
Yes.
Perfect.
Great. Thank you, Carrie. Any quick questions for her?
I remember asking her that actually when we had been elected, and then we're coming to,
know,
and I'm like, so now who's in charge?
Who's in charge? It was really.
Right.
We were
Yeah.
like, well,
So
Yeah,
Carrie,
exactly.
just so you know, I've already done the work to write, I agree with you on the governance committee, and it's mentioned at least twice in the bylaws. And so I already did that work. I can send that to you if you'd like to see it, where the two references
That's
are.
awesome.
Total
Thank
agreement
you.
with you there.
Okay, go ahead.
So like I said, it's up to the board and we can work on language and stuff like that, but those were the problems that I was seeking to solve.
Yeah, and I agree with you. It is very ambiguous about the timing of when people take over. I agree that could use some work. I've read that several times and I'm still not sure what it means.
it's really unclear.
Yeah. Okay, so good job, Carrie. So we'll keep that in mind and have it in our brains for when we get ready to work on it. Nathan, tell us your
Oh,
concept.
right. Can somebody pull up my document? Are we
Here.
here?
Do you want
Oh,
me to
did
just-
you
You want that one?
Did you put it in?
How did we all? Did I?
No, you
Oh.
gave, this is the one you
Yeah.
sent to me and I printed it.
Oh, you.
Yes, do
Right.
you want to,
Well, I
printed it.
kind of.
Yeah, we all printed it.
The screen, oh, you printed it.
I didn't
Oh,
print it,
okay.
I haven't been home for a week.
Send everybody. Okay, thank you for printing it.
Because I mean, you can work off of this.
Yeah, it was a thing.
Yes, yes, it would be great if it could get on the screen, so before it gets on the screen, I could discuss the.
Just a second, we're getting.
Sure, the basic
Because you said
concept.
sent it, so it should. I apologize that you don't have it.
Hey, Allison, can you bring up Nathan's PDF and share it on your screen?
Denise is putting it up.
Denise is getting it, I think.
Yeah,
First try.
Excellent, thank you.
Maybe she can't, Allison, can you,
Yeah, because you're recording, maybe we can't.
you can share with her.
I can.
Okay,
It'll
thank
take
you.
me just a minute.
It'll be shared.
And he's curious. Can I?
If you want, or if you want, you can like, so she's in the shared folder, just where it is.
That's where Carrie's are.
Yeah.
Okay.
So, no, that's not
There,
right.
multiple.
Tony sent an email and all three, and I printed all three.
When did he send that?
I looked at it this morning.
Oh, yeah. I was going all day, didn't like check anything out today, so.
So it's in, it's an attachment in Tony's latest email.
Perfect. Yeah, I'm gonna try not to plan other things on the day of work meeting because I really need to do homework that day, but.
That's, I mean, we were protesting.
Are you getting it pulled up?
This morning it was.
Yeah.
That's not my inbox.
Yeah, we're getting pretty good.
Yeah.
We need this.
There you go. It's up.
So you can go back.
There you go.
Can you maximize it on the screen?
There we go.
Oh, okay, right. So I wanted to make a visual aid. It's impossible for me to talk about it. So what would be my motion one, which is not a motion, but in point number one, I highlighted a couple points just for us to notice, but my change would be in red. And so the concept I want to discuss, I've had lots of community input on this topic. And my reading of the bylaws is the community funds the hospital, and in exchange for the funding of the hospital, it elects 7 people to represent the community. And their desire is that the board is equally involved and equally informed. The conflict is that the bylaws, basically, the first thing the new board does is elect a chair, and then we give tremendous power to the chair. And I think it was written probably for convenience, to make it easy on everybody on the board, so there's kind of one person that does a lot of the work, and everybody else sits back and eats some snacks and so forth. The community has been very clear with me that they want us equally involved and equally informed. And so these changes are in response to that concept. How much of our authority as a group shall we give to one officer of the board? That's really the question I want us to think about. So the first point there says, the highlighted portion, the board shall hire an administrator. So my question to the board is, who is Kathy's boss? If the board hires the administrator, the board should be Kathy's boss. What I have X'd out is a self-contradiction. It says the CEO will report, which means they work, to the president between the board meetings. You report to the person you work for. So who does Kathy work for? The board or the chair? We do not want someone having 2 bosses. That's utterly confusing. So this is a self-contradiction in the bylaws. If the board hires the CEO, then the CEO should report to the board, not to the chair. Does that make sense?
The CEO does report to the board.
Well, I know, but
we get an update every week.
I know,
from
but the
Kathy.
bylaws say that as directed, the CEO will report to the president between meetings.
So doesn't that make sense to have one contact and then the
Well,
board,
but this-
and the chairman
yeah.
gets a hold of the board?
Yeah, but this isn't a contact. When it uses the word report, it means Kathy technically works for the chair. So the chair is Kathy's boss between board meetings, and the board is Kathy's boss at the board meetings. And I think we agree in concept that Kathy should report to the board at our board meetings. And yes, we can have a point of contact if we want to, but striking this language makes it very clear Kathy has one boss, the board.
I agree.
And
You are, I think, confusing in my mind 2 things here. We have designated the chair as currently, unless the bylaws get changed, that the chairperson is our liaison.
Right.
To, and I think that's the way I read it, as her being a liaison. But I will consider it. I'm not, since I'm not voting on it, I'm glad you pointed it out, something to consider.
So I think it's a
Okay.
self-contradiction.
Okay.
If the board hires the CEO, then who is the CEO's boss? Is it the board, or is it the board and the chair? I don't want to have 2 bosses. That's utterly confusing. And to your point about the liaison concept, which is next, as it relates to the chair.
Okay.
I actually looked up the word liaison. It's not a word I've ever used or been exposed to heretofore in my life. And the definition basically is someone who sends and receives messages. It's not a decision maker.
I agree.
It's a sending and receiving
The
of
board
messages.
makes the decisions and the
Yeah.
chair
Right.
can pass them
And
on.
so the first thing is just, who is Kathy's boss? And
So,
it's,
okay, so if you go with that concept, then that means Kathy has 7 bosses.
well, so the question
Doesn't that
is,
mean
it
7
will,
bosses?
it doesn't,
board as a
here's why. So Dottie used to say, the board has one voice, the chair. I disagree. The board has one voice when it makes a motion, deliberates, and votes. Only then does the board speak. That's our voice, is when we approve a motion and we officially give direction. And because, keep in mind, we're really supposed to be involved with governance. The budget, strategic planning, those sorts of decisions. We're not in operations. We don't need to be involved with how much pills should be in the pharmacy and so forth. And so I think the board has one voice. 7 members get elected to be equally informed and equally involved. And the board only knows what it thinks once a motion is made, and then we listen to what each other thinks. There have been many times where when we start deliberating on a motion, my mind gets changed. And I end up agreeing with an idea that I never would have thought of myself. So the board doesn't know what it thinks until a motion is made, it's seconded, and every person has their chance to state their perspective. And that's what the community wants, is it wants us all to bring our individual life experiences to this board. And I want to hear everybody's perspective. And only once we deliberate and we vote, does anyone know what the board wants. No one can possibly synthesize the deliberation process by talking to every board member on the phone. I never got to hear what Ted thought and what Mary thought and what Cream thought. And if I had, I may change my mind. They may have an idea I would never think of. And so that is the inherent weakness of the liaison concept, is no person, even if they call each of us individually and ask us what we think, we are deprived of hearing each other's thoughts, which many times have changed my mind. And so the board has its one voice when it speaks in its open meeting by approving a motion. And until the board votes in an open meeting after deliberating, no one knows what the board wants. That is the board's voice. And yes.
But Chair, I want to kind of move on to your next, because we can have the discussion. We need to have this discussion. Is that the chair is the liaison for the board's wishes.
Well, right.
All right, so we make a discussion or the decision as a board. The chair is aware of what her decision is. That's what the chair is the liaison from.
But Kathy's here. She knows exactly what we decided, and we take minutes. There's no need for someone to tell Kathy what was decided. I don't think Kathy has memory problems, and we do have minutes of the meeting, and I mean more than normal. I have some memory problems, but they're hopefully normal at this point. So when Kathy hears the board approve a motion, that's us as her employers giving her direction.
Sure, but if it comes to, let's say, an agenda item, what, do we want this early in the evening, later in the evening?
Right, and so.
That's the talk that Kathy and the chairperson.
Yes, so as we already, as you pointed out on page 5, the chair or president of the board is given specific authorization to set the agenda, and that's separate from a liaison concept. So that authority for the president to meet with the chair is already given in this section. The liaison concept is not needed for that to happen. So the chair can have individual duties that we would like to have. The idea, though, is no one can possibly know what the board would choose until we all meet together and we all listen to each other and then we vote. Until then, no one can possibly, even if someone calls us all individually, we're deprived of the deliberation process where there have been several times where I have heard a motion, I know what I think, I hear another idea, and I think that's way better, and I never would have thought of that myself. And so, just throwing these ideas out. Okay. There's an inherent flaw with the liaison concept. The board has one voice when it votes after deliberation, that's its one voice. And no one can possibly synthesize the board's voice by talking to us individually because we're deprived of hearing each other's thoughts, which on many cases have changed my mind and I make a different decision. So points 2 and 3 were of the liaison concept. And especially since we've agreed to potentially have 2 meetings a month, then I think almost anything that Kathy or Allison needs the board to really decide on, they can come to the board in a meeting and ask us together, and we can be the community's voice together. We don't really need the liaison concept since we have agreed to meet more frequently. those sorts of big picture governance items can wait 2 weeks. And so if the board really has a legal matter that it needs to hear about, Allison should come to our meeting and tell us all together. And if Kathy needs something from us, she should come to a meeting every 2 weeks if we need, and tell us all together. And we should go through the process of listening to what each other thinks before a decision is made. And that's the inherent flaw in the liaison concept, is no one knows what we want until we all meet together and we hear it and we deliver. So that was point 2 and 3. And then point 4 took a lot of work, and it just looks at whose job should it be to appoint the committees, the chairpersons, etc. And these changes all say that I think the balance is a little too heavy. We've given up a little too much of our group decision making. And I think it would be better if the board decided what committees we had, and if the board decided who the treasurer was and who is on each committee, rather than delegating that away.
The board does do the offices, because we all voted.
So it says here,
It's the committees that the chair appoints.
it says, the president of the board shall preside all meetings, shall execute all documents, shall appoint committees, and the chairpersons of such committees is authorized by the board. So I think it should be the board that appoints committees, appoints the chairpersons, etc. And that's probably giving up a little too much of our group decision-making, probably for the sake of convenience.
We are talking about our standing committees in this section.
Which are already formed. So I'm not saying we go back and make any changes.
Yeah.
I'm saying going forward, if you recall our first board meeting.
But I think you're confusing, in my mind, you're confusing your elected secretary treasurer or your appointed secretary treasurer to your standing committees, and this deals with the standing committees section.
So
when you have a situation of 4 brand new board members coming onto the board, as we've had, could possibly happen again, who knows? How are you going to nominate and present and decide who's the chair of those committees?
Right. So
when you got 4 brand new board members,
right,
not knowing what
you
they're
have
doing.
4 brand new board members, and so the board has said it's time to appoint a treasurer. Are there any nominations?
Yeah, but we're talking treasurer.
Right.
That's not a standing committee officer. The standing committee is a special quality committee.
Right. Right. So the standing committees are always in place.
Yes.
We're not talking about forming standing committees.
But the paragraph you're.
We're talking about who decides who the members of the committees are.
Sure.
And that's all I'm saying is perhaps the board should not delegate that entire decision-making of which people are on all of the committees. Perhaps it should make that decision together.
Okay.
That's all that
I just didn't want,
Yes,
you
thank-
said
thank-
secretary
Yes,
once or
yes,
twice
sorry.
or something, and
Yes.
that's
But
not
I
part of
think,
the standing.
I hope if you have time to read it.
Oh, I will.
I
I
hope
will.
it's clear.
Okay, do you have any more comments about that?
Now, you haven't done you just took a few pages. You will have more.
I do have some more. I just wanted to focus on the single concept of where's the balance? If the community elects 7 people and they want them equally informed and involved, how much of that board authority should we delegate to an officer?
Can I ask a question?
Yeah.
Do you feel like you don't have any authority?
Well, I'm not really supposed to have any authority.
But do you feel like you don't have a say in anything?
Well, I have one say in each decision that comes to the board.
Okay, so, and that's all, we all have our decisions, and we always discuss stuff. But we have to have, in my opinion, we have to have one person that is the communicator between us and the CEO. If we have all of us going at the same time, it's just
Well,
confusion.
right, so here's the point. If we're gonna meet every 2 weeks, we're only involved with governance decisions. We're not involved in the day-to-day. A motion is brought before the board when we deliberate and vote. That's our voice. that's our direction to our CEO or to our attorney. And if they need to know what we want to do, they can come to the meeting and ask us, and we can all vote and deliberate and tell them. And so the problem with the liaison concept is no matter if each person is individually contacted, I never get to hear what you think and what Corinne thinks and what Ted thinks. And many times by listening to what you think, my mind has changed and I end up making a totally different decision than I would have made. And that you can't synthesize that deliberation process, even if one person calls every person on the board. And so I think we make the best decisions together after we listen to each other. And so
Don't we do that?
We don't have any.
So, well, this is, I mean, to be, when we move into all of this, but I do remember you and Carrie both saying, and I think Nick too, about how you thought that the bylaws gave too much power to the chair. So I would really be interested to see, you know, like where you guys think that balance is to, like what, because you've seen it on the previous board before and then now. And so I don't know if you want to comment on any of that now or not.
I think, right, like the whole thing with Carrie's, where Carrie's talking about the chair being able to remove people off the committees. I feel like after the board has voted on who those committees are, I mean, I did assign and then we voted on the committees. That I think that's an overreach when they start, but honestly, I would be really interested in right now, I can't hardly even, because of other stuff in my brain, I can't hardly think of to answer your question, Corinne, but I would be really interested because with exception of the deal where I said that we needed to see that document all together, I don't know what decisions that I have made that the rest of the board hasn't been involved with, as far as aside from calling meetings and figuring out when people are available, I don't know that I've made decisions that based on calling people aside from meeting dates.
So, Ann, you told me on the phone that you do make decisions for the board, but not as many as I think. So, you did say that.
I might have.
And someone else heard it. In addition to me.
Can I ask Allison, is there anything in these changes that have been proposed that have any legal weight or that are any concern?
Yeah, there are some. I don't know that you want me to go through it, and I got this today, like 2.
Yeah, I don't.
Or whenever it was sent, so.
I just wanted to see if there were, so that we knew kind of the areas that we need to look at. So this is something that you need to refine, because there are some.
I think there's 2 issues. One is, how do you all want to govern? What's good governance look like? And that's a board decision. And then second, there are some things that just logistically, legally are not correct. And sometimes they can be fixed with a word change or 2. Other times the concept just doesn't fit the law.
Correct.
So like, I think that's something that we need to be thinking about, and I don't know, I'm not sure, I don't know what the balance is, but I do think we need to be thinking about whether the whole 7 bosses problem, because right now it feels a bit like a free-for-all, and that anybody can come in and give Kathy directions or things to do.
Never worked on this.
And that doesn't work.
Never worked.
And
Agree. So I'm not proposing 7 bosses. I'm proposing a single boss, the board, when it votes on a motion. That is the board's voice. There's one boss, the board, and when something needs to be decided, Allison can bring it to us. We can all listen, we can all deliberate, we make a motion, we vote, and the motion is our voice. The motion is the boss, the one
I agree,
voice.
but what
And-
happens
right.
in the situation that Kathy, for whatever reason, couldn't be here for a meeting? Had an emergency someplace, had to be out of town. Who's your liaison to know what we voted on?
Kathy at that point.
Well, so either JT or John would take her place, and if you notice, you're attentively listening to all of our meetings.
No.
They're all up to speed, and since Allison attends all of our meetings, she's up to speed too. I believe she takes notes, so we have multiple people that can get.
Currently,
the
we have
successor.
multiple people, and we're very fortunate to have those people.
But we have
And
Allison. We
have not
decided.
had those people. Currently, we have
successor.
multiple people, and we're very fortunate to have those people.
But we have
And
Allison.
We have not
decided-
had those people in the
But
past.
we decided tonight to keep Allison in the current format. I believe she's paying very close attention to all of our
Oh, yeah.
decisions. And I believe Allison has recounted, ancient history from my perspective to us several times. And so we have multiple points of contact who could do that job. And
Okay,
so,
I'm not here to argue about that or discuss the merits or.
so I'm not advocating 7 bosses. I'm saying one boss. And the one boss is when the board speaks together in its meeting. That's the only boss of the board. That's the only voice of the board. And we need no other voice than that.
So, let's make sure that when that before any of us ask Kathy to do something, that we all have voted on it.
Oh, yes.
You have the board's complete permission.
Right. Yeah. I think if someone asks Kathy.
Or it's come before the board and majority has voted.
I think if someone asks Kathy to do something, Kathy should hear it as a request, that if she wants to, she can do that, and if she doesn't want to, but she doesn't hear it as an official act of the board. If one board member speaks, it's just one board member speaking.
That sounds good and all, but
Yes.
you're all my boss. So when you come to me and ask me for something, that's not as easy said as done. I don't just go disregard what somebody said they wanted me to do. I won't do that. I can tell you that's not my personality.
Right. But if you hear an individual board member speaking, my goal is that you hear one board member asking you for something, which is different than the whole board voting on something. That's the true voice of the board, and that's the way the community would like us to do things. And they don't want us delegating that to one person who speculates about what we all may decide.
Well, and at some point then, you guys would have to really think about what leverages you give me, because right now, and I actually looked, there's no place written down that I have a $10,000 budget limit, but it's been said. But the truth is, I had a chiller breakdown, and I couldn't even really make a decision about that. And there's certain dollar amounts that don't even make sense to me, because I have to run a business. So, and I'm not saying I should be accountable for those decisions. I should totally be accountable. And I'm not saying I want the moon and the stars and the sun, but I have to be, there's things I need to act on.
You have the responsibility and the oversight of day-to-day management of the organization, and the board has to have confidence that you can do that.
Yes.
Was the $10,000 thing just for Randy, or was that not even really a thing?
It wasn't a thing, it's not.
Well, so Judd told me he had a spending limit of $7,000 or $10,000. Randy said he did. I've never seen it in writing.
It's not in writing.
So I don't know.
I mean, I'm not gonna go spend a bunch of money that I don't tell you all about, but there is frustrations, like I had a $10,000 floor repair thing, and then we had to bring it to the board, and by that time they revisited the bill and said, oh, now it's $14,000. Well, then I'm like, well, now I can't approve it. Before I had approved it, but in the months that it took them to come back, they upped it $4,000, and so
I think in that
that's now a board
situation,
decision.
if something breaks, you should be able to fix it, and you don't need our involvement.
Yeah, well, I know we can't vote on that tonight, but my point is, loosen up a little bit, please.
And those are,
I need a little bit of leeway.
those are kind of the Kathy's probably not gonna go over hers because of time. But those are more or less the recommendations, and that would be up to Alice as well, that we have looked at, is just to clean up allowing her to do some everyday managing of the organization, take care of staff. If something breaks, they're emergencies. I mean,
They get what I'm saying.
if we have a Genetech and a generator.
Is there a reason why you thought you couldn't
Yeah,
get the chiller?
because I got the idea that it was a 7 or 10,000, I didn't know which, but I went with the 10 because
Yeah.
I liked 10 better than 7.
Right.
And so,
So we all think that was a thing, but it wasn't?
I've never seen it right.
I've never seen it in
That's
writing.
crazy. Yeah.
So it was something.
If I recall, it had to do with a vendor, that there was a per vendor limit that, and I don't know that I saw it, it may have been something approved by the board as an operating rule.
It might be in Kathy's contract.
Oh, yeah, that would be a good place to look.
I don't think it's in my contract.
I don't think that.
No.
But Randy sure thought he had 10,000. I remember him referencing that multiple times.
And if that's what, he probably deserved to have a 10,000.
No, he deserves about 10,000.
But the point is that it hamstrings me a little bit sometimes.
I don't know if it's really a thing, actually.
Okay.
I mean,
Well, I'm just saying it nicely, please, if think about it.
okay, let's move on to the chiller.
The chiller, we tried to get an exact number on it, and we can't get it, but it's gonna be somewhere between 20 and 30,000 to replace the compressor on it and install it. So, I don't have a good number, but if we could get it approved for up to 30,000, and then if it comes in higher, I'll have to come back to you all. And I tried like heck to get it, because it broke down last week. We were running on one chiller, and that's a lot for the things that we have in this building. So I'd like to be able to get that replaced. And usually I have to tell you a dollar amount, and that's the only one I got right now, is 20 to 30,000.
That's a life safety issue in the hospital.
Yeah, it's a life safety issue.
Yeah, and then when you roll over to just one, it's putting extra stress that will cause that one to have an issue.
We actually, like, we didn't get an employee here. It sparked and
Is that the chiller or the compressor?
the compressor that's part of the chiller piece.
A lot of times they put the chillers inside and the compressor outside.
Yeah.
That's separate units. but-
Yeah, all I know is a transformer, what do you call that, one? Tripped.
Sure.
And then when he went to try to switch it back over, we didn't know if we'd lost the box as well, so. It's like 480 volts or something, it's huge.
So that's the motor on the chiller.
Yeah,
So what you're wanting to do is replace the motor on that chiller.
he says compressor, that's what the guy that came.
Yeah, I don't know,
Yeah.
I'm not,
I'm
they're broke down
not a
in
mechanic,
components.
I know what they told me they need to
Yeah.
replace is the compressor, and then the installation with doing that.
And we're limited with vendors.
You've got.
JC can. Yes.
Madam Chair, may I make a motion that Kathy is authorized to spend, I hate to say whatever it takes, to fix the chiller because it's a life safety issue, or shall I attach a dollar amount to it, like up to 50,000?
That'd probably be safe.
Do we have a second?
That's my motion then, that we
I second
authorize
it.
Kathy to spend up to $50,000 to fix the chiller, which is a life safety issue.
Nathan seconded.
Yeah,
Nathan seconded it. Is there any discussion?
I'll let you know exactly what they replaced when they do more formal stuff, but I
Oh,
will
I'm
compressor.
not an air conditioner, they break it down into units.
All those in favor say aye.
Aye.
All those opposed, say. Okay, now we're on to community needs assessment.
I'm just gonna give you a short version. There was 3 companies that we looked at for community health needs assessment. It's old business because you guys have talked about it before, that you need to get it done in 2024-25, our fiscal year. And there's a business called the Cycle of Business. It's a traditional, what I call a traditional setup, which is that they come in, they do some research online and stuff relative to our data for our county and our state and that sort of thing for health components. And then they have community members come in that we kind of select for them to come in and talk to them and then get a community needs assessment done that way. That's $10,000. There's a company called CBI, which does probably, well, they really tout their research, so maybe they do a little bit more research, more in-depth research, I'm not sure. And they have, they do 1,000 mailers, right? And so they have quite a list of things that they do. They cost $35,351. And then,
how many households are in? We only have 4,000 people here.
well, that's like a fourth of the representation. I don't know if they can get to a fourth
If you're
from the
3,900 people in a year, that's probably
right.
less than half that in households.
Right.
That sounds like an overreach.
Right, and then there's a CNA group, CRI/CNA, and they do the research as well, and then they do phone calls to people. That's 20,000, and then they put the report together. So, I mean, I don't know how you all feel about it, but I feel like we have to meet the regulation. It's a regulation. I think it's important to get good data, but I almost am more involved in going with 10,000, just being honest with you, because the others are maybe more rich, but quite frankly, we're trying to work on a transformational model potentially, and I just think that we talk to the community members that know the community and see what we get from that and not spend quite as much money. I mean, if we were rich.
And I think this one might be quicker.
Yeah. So, is anybody have a hiccup about not seeing the details of the pieces, and are you okay if we go forward with the $10,000 contract?
And we do have them right here.
So if you could vote on that, that would be great.
So I would entertain a motion.
Okay, I'll move that we have Kathy move forward with the Cycle of Business proposal for the community needs assessment for 10,000 fish.
Any discussion?
Thank you.
All those in favor say aye.
Aye.
All those opposed, the same. Okay, I think we're ready for executive session.
These are, that number 4 is.
Yeah.
Yeah, you do need a motion to exit.
Right.
Yes.
So I'll do the reading this time. I move we go into executive session under 16-4-405, subpart A, subpart 2, to consider the employment of a professional person or employee, and subpoint 3, on matters concerning litigation or potential litigation.
I'll second.
All those in favor say aye.
Aye.
All those opposed, same.
Good job.
See you, Walter.
Thank you.
Recording stopped.